call the meeting to order. Do I have a motion to approve the agenda? Ms. Hines. Is there a second? Mr. Hogan, second. So, all those in favor? Mr. Watt? Thank you. That's unanimous.
And Mr. Lewis is on the line.
Oh, sorry, Mr. Lois. In this huddle, I told you I was going to mess up with y'all right there. Were your hands up? Thank you. That's unanimous. Okay. Action agenda is going to be, I had a couple of remarks to make. As we move on to the next phase of reentry, Dr. Melton has important information to share with the board. I know this board is committed to listening to all the concerns, as well as a commitment to do what is best for all the students in D5. We look forward to hearing the data and the numbers and the specific needs in each school. I do believe as a teacher to evaluate and to adjust are key to any plan. This is not an easy task, and there's no exact best answer, but I do believe this board took an important step by passing a motion to ensure Dr. Melton has the support she should have and needs to have as she makes her recommendations for any change in the reentry plan. And we all know getting back to 5-day, every day is what's best for kids. And we appreciate hearing from so many teachers, parents, and even students. And the opinions varied, of course, and we will look forward to Dr. Melton's presentation. And we do really thank everyone. I know we've been inundated with lots of emails, but truthfully, all these board members appreciate that because it gives us the view of the community, the teachers, and the students. So with that, Dr. Melton, I'll turn it to you.
Thank you, Ms. Hammond. Board members, I'd like to echo and for the community to hear as well. I'll do a sound check. It seems like there's a little bit of a feedback in the room. Ms. Price, let me know 1, 2. Okay. Mr. Isbell? Okay, thank you. I'd like to thank the staff. Of course, every board meeting requires a significant amount of preparation, and this staff has been prepared for this special called meeting. Chair Hammond, thank you so much for assisting me with getting this meeting together so we could have this critically important conversation. I'd like to echo Ms. Hammond's remarks, expressing appreciation to our families, our staff, and our students. One of the tenets of School District 5 of excellence is the fact that our community takes their voice so responsibly. And because of the responsibility they take, how they reach out to share their perspectives, their input, their family situations, and just how trusting our community has proven to be with things they've written to me and the board. If the board were to report to you all how many emails they've received, I don't know they've had a chance to read all of them because of the engagement. But on behalf of the faculty and staff of School District 5 as superintendents, I applaud this community for their engagement and their interest to always make sure that we provide excellence. The board, for you all to know, has received presentations throughout the day today, so I regret they did not have the time to prepare as they normally would. And I'd like to make sure that I go on record for the community to hear that's on the staff and on me. Of course, Thanksgiving was last week, so we were technically closed Wednesday, Thursday, and Friday, and we're supposed to have been closed for the weekend as well, but many staff members have worked throughout the vacation to make sure that they were balancing the holidays with their own unique situations, but also the management of the operations of School District 5. So for you all to know as a community, this board has not had the time to prepare with presentation information for me the way they would for any other meeting with board packet to be consistently presented to them. The first few slides I have this evening are ones that we have shown before. This specific presentation is entitled Reentry Phase 4 Update. We, of course, have been naming the different phases that School District 5 is operating within. So as we get prepared to show you the slides of where we are, you've seen this slide showed before. We have grounded our decision-making with 5 guiding principles. If you loop around from the bottom left around the graphic towards the right, you'll see a variety of different perspectives that we have used to make sure that we're making decisions to what we believe is the right vision and mission of School District 5. This next slide is one that you've seen before as well. We look at the considerations that we give to the operations of School District 5 to include data. On the 16th of November, I share with the board and with our community the number of schools that were dealing with active COVID cases. As of 10 o'clock this morning, I can share with you that 22 of 23 sites of School District 5 have now had at least one positive COVID test of a student or staff and or both. So we're up to 22 of 23 schools. Transportation, of course, is critically important to our success in School District 5, so that is a tenet of consideration for our operations. Then, of course, our facilities and student nutrition. Continue to applaud our nutrition staff. Over 850,000 meals have been served during this time of operations, and families continue to be supported, and students continue to be fed. The last board meeting on the 16th of November, the board heard me talk in different details about the scheduling component and how our staff was stepping in to cover sections, to cover classes, to cover responsibilities for one another. Last minute notification when they step in. Unfortunately, this scheduling constrictions and strain has continued to escalate since I shared with the board on the 16th of November. And then, of course, input. The number of emails that we received, the conversations that the board has likely had, the number of conversations and visits that I have had, and the extensions of our staff and this administration to be visible in sites, to be directly communicating with those that are doing some very hard work that is mission-focused and vision-oriented. And of course, all this is supported by priority number 5 that the board has approved with my goals for the year, to promote a place of work and learning where the staff and students can be safe socially, physically, and emotionally. This, too, is a slide that the board has seen before regarding phases of reentry. We have added different phases to this since our operations have been changing throughout the summer into the fall. So this is just a pause for you all to see where we are currently. And of course, this board heard our last phase would be inclusive of phase 5, that we were looking ahead to identify February the 1st as a day of 5-day instruction. So we're currently operating within phase 4 of having our 7th through 12th grades added on November the 9th to be added to a 4-day site of instruction across School District 5. Our Director of Accountability is going to come forward next. The board has received this afternoon a variety of data points we wanted to be sure that we talk through. So Mr. Holden is going to come and cover the next couple of slides. Director Holden.
Thank you, Dr. Melton. As Dr. Melton has just mentioned, we're going to be taking a look at a couple key data points here as we work through the information on the slides to help you understand the data that we're looking at across a variety of departments in School District 5. And Dr. Melton, I might borrow your clicker here for just a second. Thank you.
My apologies.
Thank you. So our first data point we're looking at here is the total number of students in a COVID quarantine. And we've got the graph laid out for you in a way that we want to explain here. Of course, we have the vertical axis that indicates the number of students that are in COVID quarantine. The graph is laid out by week. So we're looking at how many students by week are in a COVID quarantine. And you can see the data that our nurses in coordination with Nurse Stanek and her leadership have pulled together. And we've disaggregated the data so that you can look at it when you're looking at the data. You'll see elementary and intermediate schools, and you'll see middle and high schools. And those two groups are grouped together. And we've also plotted the November 9th date, which is the phase 4 of reentry. And what you can see over that time period is that we've had some fluctuations, but overall, especially at the middle and high school, recently we've had an increase in the number of total students who are in a COVID quarantine. The next slide shows a little bit more information, this time looking at newly identified students who have tested positive for COVID. Again, this data is collected by our nurses under the leadership and guidance of Nurse Stanek. And so what you're seeing here is a synthesis of the data that they've been collecting over the last several weeks and months. And this data also indicates that we've had a recent rise in the number of COVID positive students, and that increase is different when you look at the different levels. We've got a higher increase in middle and high schools than we do in elementary and intermediate. The next phase that we've been looking at here as well, and this has been done under the direction of Dr. Tamara Turner and the Human Resources team, as we've been looking at teacher and staff attendance and teachers and staff who are in quarantine. The graph is laid out very similarly. We've tried to make it as consistent as possible to make the analysis easy for everyone and transparent as well. And so what you can see there is we've got an elementary and intermediate school total, and we've got a middle and high school total. And you can see how those numbers have fluctuated over the last few weeks as it relates to the teachers and staff who are in a COVID quarantine in our schools. The last data point is a little bit different because this data, you've noticed the other slides, we've looked at the data by week. Okay, so that's a weekly number that we've been looking at. Due to how we track the absence data for our teachers and staff, we're actually able to compile that number on a daily basis. And so what you see here is, again, the result of the hard work of our human resources team in trying to understand the patterns that have emerged in terms of teacher and staff absences. Now, one key note about our teacher and staff absences is that the data that you're looking at on this slide does not include the quarantines that we have as well for teachers and staff. These two data points are separate for different reasons in terms of how the information is coded. Dr. Turner and her team can speak more to those differences, as can their standing. But the two slides are meant to be looked at together, as opposed to thinking that one has all the information. There are different data points. One, again, shows the teachers and staff who are in a COVID quarantine, and you can see that number increasing over the last few weeks. And this data point shows by day the attendance patterns in our schools for teachers and staff. At this point, I'm going to turn it back over to Dr. Melton. I'm going to bring you back your clicker.
Thank you, Director Holden. I'll just keep it because I may just ask you to flip back and forth with a couple of slides, if you will. So let me revisit the why. We, of course, have a slide here that brings us back to where we began, reentry phase 4. Ms. Hammond, I appreciate so much your leadership to allow this opportunity for a special call meeting. I have listened very closely and read and reread the motion that passed on November the 16th, and I'm bringing back to this board seeking clarity so that we can make sure that the decisions that this administration makes from this point forward, what we need to do to make sure that I am in compliance with the board expectations and in operations with a safety and security sense of responsibility for our community, for our students, and for our staff, and of course, always with the vision and mission focus of the purpose of this school district to educate students and to prepare them for short and long-term success. So Ms. Hammond, I suspect there may be some questions about the presentation. If you'll guide me as how you would like to manage this, Mr. Holden will stay at the mic for just a couple of minutes in case there's some specific questions about the slides that we have for data. So Ms. Hammond, I'll turn it back over to you at this point.
Okay, and I will entertain any questions from the slides or from any of the presentation. Any questions? Yes? No, you go ahead.
So if we're supposed to look at those two slides together, can you explain to us, I mean, we see how many actual COVID cases there are in students, but we're not seeing that in teachers. Is that we're supposed to infer that these teachers are out sick, that this is the quarantine number 32 and 15, but the other numbers are in the hundreds or 100 plus, that there are 60 plus teachers. You said they're not even the same number, so there's 100 plus teachers that are out for various reasons that are not quarantine related, but that could include lots of things.
Attendance could include a variety of factors of why a teacher might be out, personal or sick leave. So it could include any number of factors. The quarantine numbers are specific to teachers who are quarantining due to COVID-related reasons. We also have the data, although it wasn't included as a slide here, about the number of teachers who have tested positive for COVID as well.
But that number is included in the other slide because they're obviously, if they've tested positive, they're absent for health reasons.
They would certainly be quarantining at that point and would be included those numbers. Nurse Stanley, do you want to speak more to that piece?
And Mr. Holden, let's make sure we toggle between the two, and because we do have two board members participating virtually,
Yeah, I can't
I want to
see
make
that.
sure that we have an opportunity that someone sees if either Ms. Huddle or Mr. Levis has a question when it's time. So when we look at the quarantine, if we'll pull that slide back up, Mr. Holden has explained that quarantine, of course, as Ms. Gardner is asking, is directly related to COVID, to make sure that staff have been quarantined with the 14 days as expected by DHEC. And then the absences piece, I'd like to make sure that Dr. Turner were to come forward, and also Ms. Stanek, maybe she would like to add to that. So Dr. Turner, our Chief of Human Resources, is going to come forward to talk about the slide that has, and I'll wait to make sure we can pull that. We're managing several things at once, so my apologies for this management of a variety of moving pieces, but want to make sure that we see the board members that are participating from home and that they too have the opportunity to be engaged with us. So Ms. Turner, while that slide is being pulled up, since the board has access to this, would you talk us through that slide?
The one slide includes the data for the teacher and staff absences, and I think I heard the question correctly. I think the question was, does that mean these are non-COVID related absences? And the answer is yes. So on top of the quarantine, isolation, positive cases, we also need to show the impact of just the normal day-to-day absences, because those concerns have not gone away either. And these would be personal reasons, normal, non-COVID related sick days. So yes, this data is inclusive of that.
Ms. Hines?
I have a question relating to that answer. And you may not, there may not be an answer, but when you say that these absences are non-COVID related absences for sick days or personal days, do we have a gauge of how many of these numbers are reflective of teachers that don't feel comfortable being in the classroom right now because of our current situation?
Only anecdotal data from where they may have felt comfortable enough to share that.
Okay.
So one or two teachers may have offered or volunteered that information, but no, it is not something that we require. They can take their accrued personal days as needed without an explanation or an added reason.
Right, so you're saying there's been one or two teachers? I want to make sure that I don't misconstrue what your
Let me not
answer.
Put a number to that.
You didn't say a
Let me
number, okay,
say,
I'm just curious.
You have volunteered that
Okay.
information without quantifying it.
So clarity for that, Dr. Turner, if we could make sure, and I'm gonna look to see if someone could get me an additional copy. I've passed mine off, so I could get a hard copy, Mr. G, if you'll make sure I get, thank you, Ms. Strange. Because of the current policies that we have in place, I will say to you all that our staff is very much in compliance with policies. So as Dr. Turner is describing for you, the absenteeism, whether it's a personal day, whether it is I'm reporting a sick day, whether I'm recording a leave because my child may have been quarantined or a spouse, we continue to be mindful of those moving pieces. If we do have some staff that have expressed discomfort to a principal or to a supervisor, that is what Dr. Turner is referring to as anecdotal. So we do not require a staff member to go in and insert, I'm uncomfortable coming to work because of this. But that may be added to personal leave. That may be inserted with some other data that we're seeing to manage with this process.
Okay.
So unless the person decides to articulate that, that is not something we seek, because how we are managing it is in compliance with board policy.
Ms. Huddle had a question.
Yes. Ms. Huddle?
We can't hear.
Ms. Huddle, if you could unmute for us. There may be a slight delay as you unmute. There we go. We see that you got it. Thank you.
Can you show us the numbers for both the teachers in quarantine as well as the students tested positive and quarantined by school?
We can share that with the board at a later point. Ms. Stanek and her team continue to monitor and manage this. Mr. Holden and Nurse Stanek, for my clarity, this information was time-stamped at what time, and as I shared, the board received this information later today because of our drafting of this content to get prepared for this evening. I think it's always important to put the timestamp that's on information that we're sharing to this point. Mr. Holden, do you have that information?
Yes, ma'am, that was 11 a.m. this morning was our most recent data that we pulled for this project. And in addition to that, we do have the data broken down by school. Nurse Stanek and her team have collected it that way. For the purposes of the presentation tonight, we went with the combination of elementary, intermediate, and middle and high in order to streamline the data and make it a little bit easier to process. But yeah, we do have the data that way.
So Ms. Huddle, we have information consistent with how DHEC numbers are reported. We're managing that internally. Just to make sure that I close the loop, I've heard you say at the previous board meeting a request of some updates in the email that you sent recently to the board. As a staff, we continue to manage the number of data points that we have coming in without necessarily having a software or a person that's managing this. So, of course, our staff continues to make this a priority, and reassigning and having other responsibilities that they are responsible to execute become a part of this. So yes, ma'am, we do have it. It has not been included for tonight's conversation, but of course, that's a data point that we're managing and monitoring as an administrative team of School District 5.
I just have a follow-up question. When I do graphs like this and data points and stuff, you have to have the details to create the totals. So there has to be a spreadsheet or somewhere with the information by school. And the reason I'm pushing for that is in all the phone calls, emails, et cetera, that I've received, it appears that there is a problem at one school. But without seeing the school level data, I have no way of knowing that.
Yes, ma'am, I understand why you would say that. We have concerns about more than one school based upon the data that we have, but we're mindful, of course, that our closure for Wednesday, Thursday, Friday, Saturday, and Sunday, our nurses and administrative teams continue to work throughout the holiday. So we know that some families may not have been tested, but I can tell you if we had this conversation Tuesday a week ago, we would have had more than one school of concern to us for current operations and where we are. And if today would have been a successful day based upon the information that we were projecting as of last Tuesday. So the timestamp of this morning at the 11 o'clock hour was to make sure that we offered a benchmark to close information that was coming in. And of course, that information has continued to come in since the 11 o'clock hour that we have had updates on throughout the afternoon.
Ms. Huddle,
Mr. Lawson.
keep talking to this thing. Ms. Huddle, did you have any follow-up, or that was it? Did you hear me?
Well, I guess I just still don't understand how you can have totals without having details, because that's what you total. So I don't really understand why we can't see the details, but I'll leave it alone.
And Ms. Huddle, I would add to that for clarity, we do have the details. We have not shared it in this presentation for the point of this conversation. If this board needs that level of details, then we will find the staff to do the work to send that information out. But as an administrative team, we are managing those details, and we've got the right people that are taking this information to compile it so that we can see a holistic picture.
Ms. Hines?
So I have a question, and it may relate to your original question, Dr. Melton, about the clarification of where we are and what we expect from you. I don't know if that's the right way to say it, but what I need to know right now is, with all of this information, for me to be able to continue to ask questions, what is your recommendation? I know we have a special called meeting right now, and I know everyone is wondering what the recommendation is to move forward. So it would help me to know what that recommendation is to be able to ask questions on where we're coming from with that recommendation.
Chairman Hammond, I'll look to you. Is that what you'd like me to do at this point, or would you?
Ms. Hammond, I have a question. I have my hand up.
I'm sorry. You want to take that question and then we'll come back to, because it's her presentation. Your question may have to do with the presentation. So Mr. Lovelace, go ahead. I apologize, I didn't see your hand.
Okay. Dr. Melton, do the quarantine students get the same instructional opportunities as do students with long-term illnesses?
I'm going to ask Mr. Giuliano to come to the microphone for that one, Mr. Lovelace. We are trying to make sure that we're personalizing these responses for students that may be not feeling well but may not have results that are considered quarantine or isolated. We are really looking to the family to let us know if the child is well enough to be engaged with instruction. And then we're looking to the comfort of our staff because, of course, with the quarantine of our staff, we have some staff that are making requests versus others that may not be comfortable. So, Mr. Giuliano, as Chief of Instruction from an instructional lens, would you be prepared to answer that question for us?
Yes, so Mr. Lovelace, the level of instruction is going to vary and it's going to depend upon the school, but then also depend upon the teacher and the student's situation as well. For example, if the student is not physically able to participate in a live session because they are sick, that's going to change their instructional impact because they'll have to have makeup work or other work given to them. If they are healthy enough and they're in quarantine, but they're healthy enough to participate in a virtual session with the teacher being live streamed, that may be something that they can certainly hear from the teacher, but it's not always two-way communication like it is when they're physically sitting in the classroom, where they have access to that teacher immediately. There may be a delay in them having access to that teacher because they're participating via a live stream versus via how we're doing this Google Meet right now, two-way, back and forth. So it does vary and it depends upon the situations, but there is instruction that continues to take place when students are on quarantine or when they're at home that may become packets of information. It certainly may be live streaming. At times, they can have Google Meets such as this set up that they can have access to. But really what it comes down to is the teacher works with the families that may have quarantine to figure out what's the best possible way to handle that particular situation. But as Dr. Melton said too, it also depends on the varying levels of the teacher and the circumstances in the classroom, depending on how many students they may have in the classroom to have access to as well. So a lot of variables, I guess, go into play, so I can't give an exact answer for every single situation, which I know is difficult. But our teachers are trying to be as flexible as possible to work with every child and with every family.
Mr. Lovelace, is that okay? Does that mean okay?
Yeah.
I would just like to add, as a teacher that handles that every day in a different school district, but I can speak for all teachers, it is very individualized. I've had kids with the COVID, and they're not sick at all, but they have to stay home, and they do all my work. And if they are real sick and they have fever and they can't, they get either homebound if they're there that long, or I send the work, and it's just like a child having the flu and being out of your class. So I really know that your answer is wonderful to say it's individualized and it's in the hands of the professional teacher. And I feel like they take care of kids. Ms. Hines, back to your question. If I might, I had one question I would like to ask before we have you, and maybe Mr. Hogan, you
I got one
got
as well,
it.
yeah.
I thought maybe any questions, and Mr. White, because you haven't asked any, if there's any you want to ask before we let her give us her recommendation, because and I'll go last. I think Mr. Hogan and then Mr. White. Okay.
Yeah, this might be a question for Director Holden. The graph you showed us with the positive case per teachers or staff, and then of course the corresponding graph that you showed us with absentees within the district. Do we have a percentage of number of positives in the elementary and intermediate versus, or elementary and intermediate versus high school and middle, based on the number of teachers we have in our district? I guess if that made sense. Could you break that down to a percentage for me? Like a ballpark percentage. Is it 10% of our high school teachers that are currently out, or is it 20% of our elementary?
I can give you a ballpark real quick, but
Okay.
Nurse Sam is probably better able to speak to that, as well as Dr. Turner.
Yeah, I would have to, I can quickly look at my numbers and
Okay.
see about a percentage. I don't have it memorized.
I didn't expect you to.
But we can look at that, and I can get back to you.
Well, and I say that because we see a developing trend with high schools, and we're seeing kind of the reverse trend in the elementary side. So I didn't know if we were looking at a population of an extra 200 teachers in the elementary sector, to where the difference is, from a percentage standpoint, less than what it looks like in individual cases.
Mr. Hogan, I appreciate the question. As we've looked towards information, we're monitoring the number of staff at that school and then what may be happening within the school.
Okay.
So back to a question that Ms. Huddle asked earlier, a number is going to vary differently than a percentage, which is what you're asking, which is so much more helpful. As we look towards the intermediate, middle, and high school with the change of classes, you may have one teacher influencing over 100 kids.
Correct.
So because of the class change, because of the instructional model, because of self-contained primarily as instructional model within our elementary schools, that too is going to be a variable that we are mindful of as administration that we may not think about as a community or others that are operating outside of administration. So thank you for that question. That's something that we are managing, but we've not included that for the boards. That can certainly be something that we note, follow up for the board to see those percentages. The difficult part for us to be at what percentage do you say that you've reached a place of concern, because the percentage is going to vary per school depending on the staff that's out.
Right.
And if we look at the percentage of nutritional staff, you may have a high percentage of those that are absent, but a high percentage of instructional staff in attendance. So at what point do you say the operations and the well-being of children may be compromised, but you may have staff on site, but you don't have the operations to support it? Bus drivers. If we were to say we reached a brink with bus drivers, at what point do we say that we cannot manage the operation of transportation routes to start our day on time, to end our day on time without double routing? Because that too is a component that we're dealing with. So it's very complicated, and I appreciate the question about percentage because it's beyond the stretch of numbers to really make it relevant to the work that we're doing. Ms. Hammond, did I leave a question on the floor that?
Mr. White had a question.
Okay.
White.
Make sure I'm on here. Well, first of all, I wanted to say thank you to all the teachers that sent us the voluminous emails that were very detailed and well-written in describing the concerns they have, but also the challenges they have on a day-to-day basis. And I think my question really is, you know, we talk about, I think the resolution of this board last time was to have zip codes be some benchmark of when confirmed cases, when you know, the reentry plan might be further evaluated by this board. But it seems to me from the emails from the teachers and from these charts, the more meaningful information is the disruption that the quarantines, you know, create. We don't have that many actual people necessarily, you know, students getting sick, but if there's a confirmed case, then one of the examples one of the teachers gave is, you know, the whole row of students may have to go out on quarantine, and if it was up close, then maybe the teacher goes out with them. And it seems to me that sort of disruption impacts the quality of learning, even though if we've got kids, you know, crammed in schools. But I wanted to ask, is there something that we can agree upon, or Dr. Melton, you can agree upon? You know, I personally like these charts that show quarantines by students and teachers, because obviously if you don't have any teachers, I mean, you know, you can put the kids in the classroom, but, you know, what's really going to occur? And I think the questions were asked about per school. Is there something, a frequency and a table and a charts like this that we could get on a regular basis and the public can see? Just so, that just seems to be a gnawing question that people are asking over and over. And I don't think there's any secrets here, but the reality is everything I'm reading, and I know the public doesn't have the 60 or so emails we've gotten in the last 4 days, is there's a tremendous amount of disruption due to the close contact when the kids are brought back. The increased number of days increases the proximity that makes every confirmed case take out more people in quarantines. And one of the examples that I heard before is you can have healthy kids coming and going over and over and over because they go into that quarantine. And it seems to me that that's information that would be beneficial. I guess the question is, are there limitations from staffing or technology or something that we couldn't have a report that everybody agrees is useful and helpful that we get regularly so that everybody sort of stays in the know? I don't see what zip code confirmed cases do for us, but I do see what this stuff does. So I can see what the teachers are telling us it does in the classrooms.
And Mr. White, there's several components, I think, to your question that I heard. First, when it comes to zip codes, as the summer progressed and we were getting ready to begin our reentry, zip code information was important because we did not have a high percentage of students on campus. We had elementary LEAP experiences for elementary and middle. We had, obviously, athletics underway. We had a variety of things for middle school, summer school, high school, summer school, but we did not have the volume on site the way we have since our reentry processes had started. So I think that's an important number, or important detail to note. Another important detail I think of note is one that Mr. Holden addressed in his slides. You see the gray dotted line identifying the phase 4 of reentry on November the 9th. If you all look at those slides, you can see a pattern of upward motion. And whether it is 1 or whether it is 32, it's too many. And if you're that one, who's to say you should be that one and you want to be that one? You know, I've been blessed in my family that we've not had it up close and personal, but we have been affected by quarantine. But if you talk to that one family that has had a death or a loss or illness or hospitalization, they're going to have a different impression than someone who hasn't had that one. And I think that's important that we be sensitive to, because as superintendent, and of course as a board, you all have a different responsibility than me, but as superintendent, I'm responsible for the well-being of students and children and the community effect that we're going to have. So when there is a place for the zip code, I don't know that we're still at that same place, because we do have so many on campus doing the work of learning, doing the work of teaching, doing the work of operations, and then students, of course, doing the work of learning. I can have to make sure that I pause to thank our staff and to thank our families. There has been commitment to compliance with our face covering, with our mask, with our physical distancing, with our reorganization of a campus, of how the traffic flows, how the schedules operate. So I have to applaud everyone who's contributed to our operations, because that compliance of protocols has helped us manage to this place of where we are. I think that's important to make sure that I go on record for the community and also for the board to hear me say today. And Mr. White, to answer your question, with any data that we create, I would ask you as a board member, what staff or what resources is the board going to execute for me to get to have that? Because currently, we have one director of communications, that's Ms. Goggins. Some would argue that she's more than a 1.0 FTE, but she is a person of one with the staff around her. So if this becomes a daily update for the board or detailed by school, then how are we going to make sure that we manage the resource of that person's time and or the data collection? Because currently, I've got, and I'll use some examples. Mr. Presley pulls data from athletics as a secondary director. Mr. Wiseman pulls data from transportation and sends it to Ms. Richardson and to me. We got Mr. Bingbo, who is monitoring our staffing and nutritional program. We've got Dr. Turner, who's managing all the pieces of absenteeism with Kelly Services and with the moves that we're doing internally. We've got Mr. Cannon that's monitoring the number of facility staff that we may have that's being quarantined to make sure that we can keep our buildings clean. So all these different people, and that's just what comes to mind off the top of my head like this, when there are others that I'm inadvertently omitting to be included. So with all those different data points that are coming into us, we don't currently have a platform or a person identified to manage all that information. But instead, we're trying to make sure that we present to the board information that we believe is valuable to paint a picture for you all to see of where does the board get involved with these decisions, where does the administration have the authority or the responsibilities to make sure that I'm operating in compliance with what this board expects. So if you were to say, yes, we want to report, we're going to authorize you to have a contract, then that's a contractual service issue. If you're going to say we're going to add an FTE, that's a budget issue. If you're going to say we don't pause this to discuss further because we didn't come prepared today, this becomes a public conversation. And so with someone, they then say, well, why are you having this conversation in public? Because the board has to meet in a public eye to make sure that the board business is conducted in public. It was important to me to ask the chair to create this opportunity of a special called meeting to make sure that you were informed of enough information that has me concerned. And how often do you all hear me say concerned? I want to make sure that you're prepared with information so that your decision-making responsibilities can be executed with awareness and responsibility so that I can equip you.
If I can, let me clarify that ask. I think I heard an answer. And it says the difference to do with authority. Let's put authority aside, because my personal view is that you should be operating these schools and we should be overseeing what you're doing. But I'm hearing over and over, and I'm seeing the requests from other board members, I'm seeing it from members of the public. You know, what would it take, and this is independent of your authority. I mean, I think this is just information. And maybe people will back off a little bit and let you do your job if they have more information. But what I'm suggesting is, what do you need in an FTE or FTEs if you were to produce a report that showed, and to me, the relevant information, I mean, yes, confirmed cases are important. I'm not trying to minimize that whatsoever. But I'm also looking at the disruption that quarantine causes to the classrooms and the teachers. To have a regular periodic report, let's just say at least once a week, by school, and graphs like this that show confirmed cases, that show quarantine students, and I mean, what do you, I mean, because that's the missing piece of this conversation. I hear all this criticism about why aren't y'all producing it? What I hear you saying is you don't have the resources necessarily to produce it and do all the other job functions y'all would have. So what is that resource you need, and let this board decide, does it want to vote to give you that? If that's what they want, if they want periodic reports twice a week, 3 times a week, every day, what does it take in FTEs? If it's once a week, to me, that seems timely, but.
If I could, I want to clarify, and maybe I've misunderstood. I didn't feel like anybody had asked until you made your statement that we wanted this to be done every week. And I have a more optimistic view of, I think what we have right now, and you correct me, Dr. Melton, is we have more, you needed to come to us because, and I may be wrong, this was sort of my question, but is it more of a staffing problem? Because if cafeteria workers, and they're usually older, if bus drivers, and some of them are young, but a lot of them are older, and even custodians. And so I started worrying about staffing the school more than the illness at the school. Not that I don't care, but I feel like if we've got virtual, those people don't have to come. We're still taking care of those people. They are getting their schooling. But the kids that want to come back, because like, and Mr. White, you're right, the quarantine number is so important because a lot of those are just healthy people, whether they're teachers or kids, that have got to stay home. So I think what I want to hear, and I see Ms. Hines, I'm sorry, I didn't mean to take it from that, but I wanted to hear about if the staffing is what is causing our biggest concern, really rather than the number of cases.
But Ms. Hammond, before you go to that question, can I get an answer to my question? Is if we're going to, I mean, and I agree with you 100%, and I agree staffing, everything the teachers are telling us is if we don't have teacher staffing, that's a problem. But even more fundamental than that is, because I saw at least one board member ask a question for more information today. I've seen other people in the community ask the question. My question is a very foundational point. If we as a board say we want more periodic detailed information, and I'm personally interested in not only confirmed cases, but the displacement of students and staff, because that impacts quality, that impacts continuity, that impacts, you know, and Ms. Hammond, you probably are going to realize this when your district goes face to face. The faster you push people together, the more you're going to have people going out on quarantine, because the more they're going to interact, you're going to have close contact, and you have the CDC. But my fundamental question is, if this board wants more periodic reporting, what does it cost to do that? And let the board either say, no, we don't want that periodic information, and we understand you'll bring it to us when you think it's relevant, or we'll give it to you regardless, and let that be in the background of everything we're doing. That just seems to me that's a step we continue to overlook.
So you want an answer now from you? Are you prepared for that answer? I mean,
And if you don't have an answer now, you can bring it back.
okay.
Well, I think it's difficult to say what that answer would be without knowing what the will of the board is. So if the will of the board is to have, whether it's, and I think it's important for the public to hear, the board receives an email from Ms. Goggins on my behalf every Monday summarizing to make sure that all the newest correspondence, links of information have been updated so that the board doesn't have to say, no, what day did that email come out? Because the board gets notification before we send things out to the press. So I don't want to send the perception to our community that we're not communicating on a regular basis with the board. It may not be to the standards of some of the details that the board would like to see, but there has been a commitment to make sure, and based upon the feedback that I've received so far, I've gotten some positive responses of the weekly updates that we've offered to the board. So depending on what is asked for, I would definitely request, Mr. White, that there be additional, whether it's contracted work or whether it is an additional FTE, and you know as well as I, if there's an FTE commitment, that could be a long-term commitment for reoccurring cost. Versus, is this going to be a short-term situation that may be more of a contractual issue that we could do short-term of X number of weeks to X number of months, not to exceed X number of dollars, and then reevaluate, as Ms. Hammond said earlier, reevaluate throughout that cycle of work. I can tell you, if I were to have Ms. Stanek come to the mic and let down her filter, she can tell you that she is managing so much of data and the overload responsibilities of all the nurses and all of our school sites. They have not had a break since we have started bringing students back to campus. And I am concerned about their well-being. So in an ideal world, I would ask you if we could hire more nurses to be of support, if we could hire some clerical support to support our nurses, if we could have an FTE to manage this kind of information for our board to hear. But I do have to make sure that I pause to insert a disclaimer that there are some districts that are having what I would call a dashboard, and then they're having to go back and explain why their numbers differ than numbers from another place. So are we going to be opening that Pandora box, that we open something up and then there may not be a direct alignment that then leads to more work and more distraction of the validity of the data, when the data that we're currently sharing is what the data is from DHEC. But I'm going to go back to the clarity of why I'm bringing this conversation to the board of needing some guidance from all of you. So it would depend, to answer your question, Mr. White, as to what we would need regarding the FTEs, but I hope that I've outlined for you a picture of what could be needed depending on the information that this community would like or this board would need.
Yes, I
Okay, so
Ms. Huddle, I see.
to kind of clarify, I know I came out of the gate asking what you wanted. And one of the reasons I'm asking that is because that really determines where my questions go. And kind of speaking to the dashboard, I understand that there are concerns that the information provided on a dashboard won't match up with what's going on in DHEC. But I also want to say that I watch the DHEC numbers I look at it, they come out twice a week, and I look at them regularly, and I don't believe that DHEC is accurately reflecting the numbers in our schools. I say that because I know of a specific high school that has a certain number of students that have tested positive, but I know that there are staff that have tested positive. And I'm assuming that we're here tonight because we're going to address how our schools are being impacted on the staff level and on the student level of positive cases and quarantines. And I think from what I'm hearing is that there are specific schools, there are more than one, where there are bigger issues. We have been bombarded with emails over the last week from teachers that are very concerned in a specific school because there are several students that are quarantined, several teachers that are quarantined, an entire administration that's quarantined. There are safety concerns based off of just not having an administration. That's not even talking about the safety concerns that teachers are feeling right now with COVID. And so what I'm saying is that makes a difference of what we are trying to determine right now. Personally, I believe that it's really important for us to see those numbers at each school, because even on DHEC's numbers, there's a few schools, and I know that you clarified that tonight, that 22 of 23 schools have at least one positive case. Well, if you go and look at DHEC right now, that's not the case. There are several schools on DHEC's website that have 0 staff cases and 0 student cases. So when we're looking at that, all of that information is relevant for me to determine where we are at each school when we're talking about adjusting a reentry plan. I know that there are a lot of people that they say follow the science, and I absolutely agree. You need to follow the science and you need to follow the data, but I need the data. And so I understand that collecting that data, there may be a strain on resources. So that's when I'm speaking for myself, and I would appreciate the rest of the board to kind of give their thoughts on this. What is it that we need? If we need something, if we need a person because we're being overwhelmed and our staff is smaller than other school districts, what is that we need to get that information? I think a daily report is unreasonable because we have 23 schools and that is changing throughout the day. At 10 o'clock in the morning, there may be one case, and then at 3 o'clock in the afternoon, an administrator is hearing that there is, 3 cases, or and that expands the quarantine level, and that's just at one school. So that's a lot of information for one school. However, the administrators at this school should know what's going on in their schools, who's quarantined, if there's one class quarantined or not. And like I said, when it matters with how an elementary school is operating right now, because the students are in one classroom and they're managing, from what I'm hearing, they're managing okay, even though we have some quarantines, versus a high school where the students are switching classes and we're having issues in the hallway, and we're having issues with students, what they're doing outside of school or wearing their masks or things like that. So that is why I was kind of wondering where we're going with this. And I think a dashboard, I understand that there's going to be a difference between what's on a dashboard and what DHEC is going to say, but I don't trust DHEC right now. So I think, I would rather say, okay, well, let's pay attention to what our individual schools and our administration is saying, because I trust them. They're working really hard right now, and they know what's going on in their schools. And we need to know what they need. to be able to support them. Because I think that there are a lot of teachers that don't feel supported and a lot of families that are frustrated because when you look at a school district with 18,000 students, and I know that that's not, I know we have students in 5, and you look at, there are 20 positive cases. Parents are saying those 20 positive cases, let's put it into some perspective. So that's where I want to be able to support what you need to help both the teachers and the parents and students figure out how to best handle this. And I know that it's not easy.
Dr. Milton, if you don't mind, I've got some people waving at me. Ms. Huddle, it's a glare, and I'm sorry about.
I just real quick point, before we decide that we need to spend extra money to do a dashboard, I think that we need to ask Richland One how they do it, and we need to look into a free tool like Google Sheets that you can have access from multiple points, and they work extremely well. People from every school could put their data in, and it could have formulas. I just think we don't need to overestimate the impact of this. I work in a business that is heavily impacted by COVID, and we had to do a lot of extra stuff that we never did before. And we just, we prioritized and we stopped doing some things and did what needed to be done. So I just don't want to jump to the conclusion that we have to spend money to summarize data, whether it be daily or weekly. That's the only point I wanted to make.
Okay, Ms. Gardner, you've been very quiet.
Well, I think now is the time to make a motion that, I would like to make a motion that the school district make it a priority, reallocate resources to update a weekly website with numbers per school that are quarantine numbers and COVID numbers, and that everyone have access, not just the school district, or not just the school board members or district personnel, but it would be a website thing where everyone has access. Because I feel like there's so much, probably out of the 150 emails we've gotten this week, probably 145 of them said they just wanted more information. And that's, to me, should be a priority. And so, and it's coming, because if I only got, I'd like to know too, would you as a school district want me to only get my information from DHEC, which has been wrong, or from these teachers? Because their numbers are not what you're telling us, so they're not being told the right numbers, they're projecting what they think the numbers are. So we need all the information, everyone needs this information. So my motion is that we reallocate resources that we already have to make this a priority and do what the CDC has asked of us, which is to make sure that the community and the school district knows what the numbers are.
Is this by school?
Yes, by school. It can be easily done, like Kathy said, we can put Google Sheets together. I can volunteer my 9th grader, I'm sure he could do it. It's not that hard. So but I think we can reallocate resources because the communications people really aren't doing as much as they used to in other areas. They're already reallocated for COVID things, so let's now reallocate them to do this, because the weekly email that we supposedly get is just DHEC numbers, and I can look at that without getting the email. I don't have to, the email never changes with it. We get this weekly update, it's just links, and I can look at those anytime I want to. I don't need that email, so I'd rather not get that email. I'd rather go to the website myself and look up those numbers. So I'd like for you to reallocate, and that's the motion that I'm making.
Is Ms. Strange, did you get that? You want to read it back to the board?
Reallocate resources that we already have to create a weekly data, did you use dashboard?
Google Sheets.
Yeah, the dashboard website. Yeah, dashboard web, however you wanna, if we wanna read.
Well, I'll entertain a second to that.
Well, numbers by school that are COVID related, quarantine, and actual positive cases for teachers and for students.
Am I seeing a second, Ms. Huddle? And or a second for Mr. Lovelace? Okay. So we have a motion and a second for discussion. Ms. Hogan?
I'd like to ask a question. Dr. Melton, I know that in theory it seems simple. Can you explain to us the district office, kind of behind the scenes, with how you would fulfill this request, this motion?
Yes, sir, thank you. And just for a point of clarity, as a Google district, Google Sheets is something that our staff is very familiar with, which I heard is an idea from Ms. Huddle. So Ms. Huddle, I'm glad that you are Google engaged because we have been a certified Google district for quite some time, and we celebrate the use of those resources for those that work in a Google platform. So for us as a district, it's important that the quality of data, we have to be responsible to make sure that there's some quality assurance. With every document that we open, whether it's numeric, whether it is quantitative, whatever that may be, is quantitative or qualitative data, we have to make sure that when we open up access that there is an input and then there is a review of that to make sure that quality assurance can guarantee. So the information that the board has seen this afternoon that I've sent have included our communications staff, has included our human resources, looking at data through Kelly Services and through our Infinite Visions that records absences. And to make sure that when an absence is recorded with Kelly Services, that it aligns with Infinite Visions, which is our recording system to monitor and document an absence to an employee. So human resources has had to interface those two different platforms to make sure that they were saying the same message. And when not, they had to investigate to see where is the difference if we're off by a few or more than a few, depending on the site. So that was another piece. Of course, accountability is involved with this. Mr. Holden could share with you all that when we look at student attendance, we do not timestamp that at 3:30 on a day because we have to make sure that when we close out the academic day that we allow that teacher an opportunity if a student arrives to class late, that the registrar has inserted that or the teacher has confirmed that. And Ms. Hammond can say the number of students that leave early or exit, that is going to be happening on a day-to-day basis, especially at the secondary level. So even our attendance for our students is not validated within a 24-hour because we have to make sure that we allow that opportunity. So accountability is involved, which of course is under Dr. Harris's supervision of planning and administration. In this situation, or anything that may be health related, Nurstanic of course is involved, including nurses from all 23 sites. So throughout the day today, Nurstanic's email, her phone has been getting a variety of updates. Some have been phone calls, others have been text messages, some have been conversations that she needed to have with a couple of people as to what was happening and what needs to be done. So then a nurse may say, well, I've inserted this number, but I'm updating it because this just happened. So that update happens in live, real time. So you heard me say earlier that there was a timestamp of this information because at some point we had to control it and say, when do we end this benchmark of time? And it's so unique because, of course, we were closed Wednesday, Thursday, and Friday of last week. So when we start giving you all weekly information, there's that asterisk of last week looked differently, although the numbers kept coming in, thank goodness, over the weekend. But there were some that may not have sought medical attention over the weekend, so then today's numbers could have been affected by that. So we as an executive staff actually started meeting in this room this morning at 8 o'clock. Which is why when I emailed the board this afternoon, we had really just concluded in starting to develop the information that you all received this afternoon. So that includes another department. And then, of course, Mr. Giuliano with instruction. He and our instructional staff are working closely with principals. So if there is a school that Ms. Turner or benefits were to say through Ms. Turner or Dr. Harris were to say through Nurse Stanek, we're concerned about operations of a school. You would see shifts around of staffing to make sure that there isn't a place where there's oversight of supervision. So Mr. Giuliano is directly involved to make sure that he and Dr. Harris have worked in cooperation to make sure that there have been reassignments of staff. Mr. Richardson gets involved if we need to do reassignments of bus drivers to recreate transportation routes. If we need to have the redevelopment of schedules of where our nutrition staff reports. If we need to have new assignments for our custodial teams. And remember, we have first and second shift custodial teams. So when we look at AM versus PM, we might have a PM team quarantine, but an AM team is operational. So can we flex those hours, or do you bring another PM team to work on that PM team? So that may be more than you all wanted to know, but that's how complicated in a quick 3-minute summary this is for management and administration of this district to make sure that we're responsible for every facet of our operations. So every department is involved with this decision-making and this alignment of resources. And of course, I think we would all agree our most important resource are human resources because every staff member of School District 5 is a vital part of our operations and the success for our students. So I don't know if that gives you a clear answer, Mr. Hogan, but I hope that gives you some insight to how the operations interact, because we are truly a collaborative system with a vision and mission focus.
So Dr. Milton, for clarification, basically, you're saying that that's not a simple, the motion to do that is not a simple task. Is that what you're saying? I mean, because it involves so many departments, I'm just saying about resources.
Let me make sure I'm clear, Chair Hammond, if,
In other words, from the motion,
Mhm.
the motion's on the table, I'm just trying to get, that we're clear on it. But your answer to Mr. Hogan, where you gave us all the examples of what it would entail, would there be maybe an amendment to the motion where we could still get the information, Mr. White, but it would not entail the?
Well, let me, and I really want to make a comment, and I'm happy to make an amendment. I think it's wrong for us to start off as a board and say, we direct you to reallocate resources. I mean, I have no idea whether you have the resources to do it, and I trust you to tell us. In fact, I think what you articulated was you were concerned about resources. So the last thing, and after reading 50 or 60 emails from teachers explaining all the additional things they do in their daily lives as they deal with pandemics and deal with the emotional health of kids and deal with the cleaning and the extra this and the extra that, the last thing we need to be doing as a board is arbitrarily just throwing more responsibilities on people. But I think you also said we don't need to have information that's not reliable. I think the information's helpful for a very simple reason. And it's never my advocacy that we sit here and micromanage what you or your staff do, but it's there for everybody to see why you're doing or recommending the things you're doing. And I really believe that knowing the quarantines of teachers and staff and the confirmed cases allows people to see at a school level where the needs are. I mean, we're seeing in these emails that there is one high school that has a dramatic set of issues going on right now. But I hate to use the word transparency. I think it's just communication. But if you can do it with the resources you have, tell us. If you can't do it, tell us. If you have to reallocate, what are you reallocating and what cost does that have? Because I really don't think in the scheme of people wanting their kids to go back to school 5 days face-to-face, in the scheme of trying to still give quality education in the middle of a world that is anything but normal and will never be normal until this pandemic clears, that we don't need to be penny-wise and pound-foolish to put information that maybe helps everybody understand why the things that are being done have to be done, but also maybe also allows us as a board not to have to come back every time you need to take another step or deviation and have a special call meeting to say, okay, you can make an adjustment here or there. If it's flowing out and it's reliable, I agree with Rebecca, I don't think you even put the DHEC stuff in there. I think you put our school stuff in there. But if we don't have, the last thing I want to do is burden staff with more administrative functions when they're having to be on the front lines and deal with this stuff all day long. And if it takes a little more money, then it's money well spent to try to put our program and our quality of our education back in place. So I would suggest we take away the reallocation part, and if we want a weekly update by school, and we want an weekly update of these three components of quarantine by teachers, by staff, by students, and confirmed cases, what is it going to take to do that? And if you need more nurses to make the schools safer and contact tracing safer so that the staff feel comfortable going in and doing their jobs that we're asking them to do, then tell us what that looks like. And the board can say yes or no to it, but at least we understand what it takes to get the job done.
Mr. White, I'm going to go back to, since you made the motion and you raised your hand, I'm going to go back to you because I think your point is well taken, and there's some parts to it that we don't want to put the extra burden on. That's what I'm hearing, but I'll entertain you to clarify.
I think it's insulting to the staff to assume they don't already have this information. and it's only a weekly update, and nobody said it had to be in real time. It just needs to be weekly, and it needs to be as close as we can get it. And I think I actually agree with Mr. White. It would actually prevent a lot of this because we have all the information. The decisions that were being made would be easier to follow because the information would all be out there, and they already have it. I guarantee that, I know Mr. Holden personally from working with him at the intermediate school, and he's got those numbers, he just can't give them to us for some reason. And I think the same is true of our nurse leader here. I think she has the numbers, she just isn't allowed to give them to us. I don't know why their hands are tied, it's very frustrating, but I think that they could give them to us, and it would be very easy to have someone to upload them onto a website once a week, and I don't think it's asking that much. But I do agree that as a board member, I don't want to be in control of whether or not we go back to school. I want to hold the district accountable to run the schools where the teachers feel safe, and they're not doing that at one of the schools for sure. It's not happening, and I think there's a disconnect, and so I feel, especially with these numbers, because what they've presented to us don't sound crazy, but for some reason, when you hear it from the perspective of the 2,500 teachers that have emailed us, that you would think that what's going on is different from what we're being told, which it sounds like it probably is. But maybe if they had also the numbers too, they could look at it and go, it's not as bad as I think it is, so maybe as a teacher, I might feel safer in my environment. Instead of us being in charge of whatever, we still haven't gotten around to what we're doing here. But when we do find out whether or not this is about changing the instructional model, I want to know what we're doing to make the teachers feel safe at the schools, because that's where the disconnect is. Not how many quarantines we have or how many students that actually have COVID. It is actually about how everybody feels about being at school. And that's where we're making our mistakes. And that's where I want to hold the school district accountable. So if it involves putting numbers out that are weekly updated, I think that is the first step that we need to make.
Ms. Gardner, would you entertain or any board member, an amendment that we still get to the same goal that you have with it left, that we would provide resources if that's the only way we could get it? Anyway, I'm asking the board. I see Kathy Huddle.
I have a motion for an amendment.
Okay.
It's based on what Ms. Carter just said about the purpose of this, and so my amendment would be to exclude students and teachers who are in the 5 program from the numbers.
Oh, in other words, her motion, you're adding that to it, to exclude any members of 5. Okay.
Students and teachers.
Well, I would need a second for that amendment.
Second?
You can second by Ms. Gardner. Now, discussion, Ms. Huddle, you want to give your reasoning for that? Okay.
Well, just building on what Ms. Gardner said, is that exactly the purpose is so that everybody is working off the same page. They understand where the risks are or they're not, and people are worried about physically being in school, so that's why I think we should exclude the 5 teachers and students.
Okay, thank you. Now I have to vote on the amendment first. Yeah, Mr.
I have a question real quick, to kind of piggyback off that. Dr. Melton, the numbers you guys gave us earlier, 532 students between high school and elementary and 47 staff between the two, so we're looking at 579 people that are not currently in school right now. Of any of those, is 5 included in that data that was already?
Mr. Hogan, thank you for the opportunity. Mr. Holden, I'm going to ask you to come back to the microphones, and since you have the clicker, Nurse Stanek may need to participate with this response. And Ms. Hogan, Ms. Hammond, I'm going to ask after they explain this, I will need a point of clarification. If we're going to exclude the staff that's involved with 5, we do have some staff in both models of 5 and on site. So if we're excluding staff from 5, I would need some clarification of how that may look, because we do have some teachers that are teaching on site that are teaching a section of 5 that would definitely be involved with these numbers that could be presented depending on how we organize them. And I'd also like to say, when it comes to the information that Director Holden and Ms. Stanek has, with all the decisions we have made, we have sought legal counsel to make sure that we are acting with responsibility of numbers and access of information. And as I shared earlier with my response to Mr. Hogan, the number of different databases we have coming in, there isn't necessarily one platform. And then another piece of that, with some of the data input, some of those that have been involved with inserting the data at the school levels have been covering classes or sections of classes. So their input of data may happen after hours, may happen within a lunch period. So just more insight to the management of how complicated this operation has become. We are honoring the expertise and the professionalism of every staff member of School District 5. And I appreciate someone said earlier about the contributions of the staff. If there is something that the staff is doing that has not seemed to be effective, that's something we could take off the plate. I would say that Ms. Goggins and her team are highly effective and efficient with the resources that are working that department and have been in direct alignment with my vision, so I applaud Ms. Goggins and her team. I'm sure she's likely in her office tuned into this, but I hope that as we look towards this process of mindset of continuous improvement, that we don't forget to respect the expertise and the contributions of those that have contributed. We've never done this before like this. And because we've never done it, the quality of this kind of conversation can become constructive rather than critical. So I appreciate the feedback that you're giving to us as a staff and appreciate that you've been sensitive to make this constructive rather than critical. So Mr. Holden, I'm not sure if either you or Ms. Stanek want to go first, but I'll look to one of the two of you.
I think Nurse Stanek is going to go first. And Rachel, if you would back it up one more slide for us.
Okay, so repeat for me one more time what you asked, Mr. Hogan.
The data on the screen with 15 in the high school, middle school, and 32 elementary, intermediate, is that all teachers in brick and mortar, or does that include our staff that's teaching in the 5 program?
The quarantine numbers would only include the brick and mortar.
Okay,
Positive numbers do include 5 at this point.
okay. Of the data that you guys have, is there a deviation we could see at some point that shows the difference of positives versus quarantines, since the positive cases in 5 are calculated into these numbers? Is that something we can request, or?
So you're wanting to request?
If I heard you correctly, you said of positive cases in this matrix, if it's a 5 teacher that did produce a positive test, their number is included in this count. But if it's just quarantine, they are not included.
That's correct.
Okay.
Because they wouldn't be quarantining.
Correct,
If
in the
were,
5 program.
And I will add this to that. We have had a few positive 5 teachers, but very, very few.
Okay,
We more likely from 5 will get student positives.
okay,
And it's important to remember too, 5 students can still participate in athletics, and they still come into our buildings.
correct.
For certain things. 5 students that take CATE classes
Mm-hmm.
attend those classes physically, so I would hesitate to take them out because they do sometimes quarantine because they're physically with us. But the teachers, again, to answer your question, yes, they would not be in a quarantine because they do not enter our building. Although I think Dr. Milton referred that some do. So that gets a little complicated too.
And Ms. Stanek, I appreciate your insertion of the CTE piece of the, and remember, as a board and a community, our courses at the center, we have students from all across School District 5 come there. And then we have CTE courses, and I'll use the example of Irmo High School with cosmetology. Students from across the district come there too. So that is a very interactive environment where athletic teams may be quarantined as far as their teammates, but when it comes to CTE, it could affect all school district high schools because of how those classes are operating. And then the transportation of students that maybe go into those locations for those courses that may not be in that section, but they were in a bus ride that may have exposed them to require quarantine. Mr. Holt, anything that you'd like to add that may not have been added to this point regarding that question?
Yep, I'm going to build on something that Nurse Stanek talked about before, because I know Dr. Turner is ready to come talk as well. What we're alluding to here is the fact that the data itself can often be very, very messy. You have teachers who are teaching in 5 and teaching in person. You have students who are doing blended ideas here. And even in terms of defining how we're going to count attendance for a purpose like this, or how we're counting all the different things, these are terms that have to be agreed on and then clearly communicated and understood by a variety of individuals who are looking at this data. The process is complex. Dr. Melton has alluded to that in terms of how we define these data points and how we ensure that as we pull them on a daily basis or on a weekly basis, that we are doing it in a way that we can replicate every week to ensure that the data is consistent and consistently pulled. And it is a challenge when you have so many gray areas. This situation is not black and white where it's a cookie cutter approach on different situations. You have a variety of things occurring for each individualized student or each individualized teacher. Dr. Turner, do you want to add some information here about the teacher attendance data?
Although I think you covered it, it was just to reiterate, I think the original question was the 5 data included with that number? And I wanted to verify that it was. And just for a point of clarification, we can tease that data out. We would just need a definition of how to include those in the multiple models, but that is something we can work on if it's an agreed upon definition.
Would it be something that you could, if we agreed upon pulling that data out, could you put that data aside since you already have it so we could see how the 5 is trending versus in person?
Absolutely.
Okay.
And it's something we've already began to look at internally. And one of the things that we've noticed is because the 5 is already in a remote virtual situation, it tends to be less impactful on the overall data. Because if there are situations where our in-person teachers are requesting to be at home, even for childcare due to children being quarantined or isolated, that wouldn't be a common concern that you would necessarily see reported for 5.
Correct.
But I would like to get that data to you to clean that up. So absolutely, we can do
But
that.
in y'all's professional opinion, the cases are positive cases for 5. We're not seeing quarantine in these numbers of 579 students.
Not in a significant
Correct.
degree when it comes to that teacher attendance
Okay.
piece that I monitor.
Thank you.
You're welcome.
Thank y'all so much. Then the amendment to the motion by Ms. Huddle, you want to make a statement before we vote? I see.
I would.
Yes, I see your hand.
I believe you can make one amendment to one amendment, is that correct?
Yes.
If Robert's rule says it, yes.
Okay, I would like to, amend, I move that we amend the amendment to replace, excluding 5, teachers and students to separately reporting 5 teachers and students with the definition of who is included in 5 up to the administrative staff.
Aaron, you got all that? You're so good if you do. Ms. Huddle's probably got it written down.
We have a recording if
I
necessary.
don't.
Oh, you can do it.
We have a recording.
How about for the board, though? Does the board need to hear? You second her amendment to her amendment. Okay, seeing no more discussion, let's vote on that. Oh, okay, I'm sorry. I think I saw his hand. That's okay.
If I understand this, all that amendment is trying to do is take the 5 and separately state those people?
Yeah, so you know.
And 'cause I still think the aggregate, but we need to be as simple as possible, but if you're just separately stating and you can still look at the aggregate, then I'm fine with that, but.
Ms. Hunt.
So my question is, if we're voting on this motion to reallocate resources,
We all know that.
we're not on that one anymore, we're just on the amendment.
Yeah, we'll come back to that one.
Okay.
No problem. Right now, just to be straight, which I personally think is valuable information. I agree with where Mr. White, and you said it too. The more people know about our schools, and it's based on what we have, I think we will help the whole emotional and mental state of a lot of parents. So I'm gonna make you say that motion again unless anybody that needs it. I think I know what it's doing.
Ms. Hammond, may I insert something, just because of the discussion and because of our work with legal counsel? There could be some positions that are so specialized that we have to be aware and responsible as an administration to make sure that how we present data would not then reveal someone that may be a specialist. If you look towards some of our very advanced classes in School District 5, I'll use welding as an example. or some of our upper level world language classes or our upper level AP classes or anything that may be upper level. Because there may be some singular staff teaching that for District 5 or in certain locations, we would have to be mindful as administration not to do anything to reveal confidential information that would then lead to some legal concerns that an employee could have for School District 5. So I insert that as this amendment is considered for the board, just to make sure that you all are aware of some of the information we've been working on to try to be protective and compliance. So we've been advised by legal counsel to make sure that we're mindful to say that we have to protect the privacy of our staff and our students, not to confirm any specific groups or individuals that are quarantined or testing positive for COVID-19, because this could indirectly identify staff and or students.
But it could just be numbers, right?
Numbers,
Not really
that's all this is
saying
asking.
It could be numbers unless you're
just numbers.
drilling it down to a level of specific information. So that's why I was hoping that this may help with making some decisions regarding either this amendment or some of the decisions that the board may decide to make in the future.
May I talk? All right, before we vote.
So to that question, to what you just said, Dr. Melton, I'm trying to think about how to properly word this. So based on the amendment from Ms. Huddle regarding the 5, you're concerned that if we pass that amendment, that when we report numbers, it will identify a staff member? Is that what you're concerned about, or?
As this conversation develops, you know, the beauty of a board is the different perspectives, experience, and wisdom that you all contribute to this conversation. So I thought that was an appropriate time for me to insert, so as the conversations develop and continue, that I give you some guardrails,
Okay.
that if you decide that you want to get to a certain level of specific information, that I protect the board to make sure that you reroute and not go towards that could lead to legal issues in the future for School District 5.
Right,
So it was more preventive than it
Okay.
is responsive, if
Okay.
that makes sense.
okay, I just
Thank
wanted
you,
to.
Dr. Nelson, we appreciate that. I'll call for a vote on the amendment to the amendment. All those in favor, raise your hand. Okay, and
Mr. Lovelace,
it's
then?
7-0, and then we go back to the original amendment, original motion, that was made by Ms. Gardner, am I correct? It's been a while, so y'all keep me straight. All right, I saw Mr., I'm sorry, I was looking that way. Ms. White?
I'd come back to what I said earlier, and I'll actually make a motion that we delete the language that requires reallocation of resources. Instead, we have the superintendent, after she evaluates with her staff, that she report to us what is needed to implement that effectively.
To come up with the schedule or the.
The weekly report of what we just discussed.
Okay, is there a second to that amendment? Mr. Hogan, second to that amendment. I'll go to, well, I think Mr. White made his clear. I'd like to hear from you because you had your original motion.
I'm just gonna say it again, I think the information's already there, I don't think we'd have to allocate too many resources just to put it on the website. I think that, like I said, if we have to, we can ask Ms. Goggins to reallocate her time that she sends us emails to do that instead. I'd be just as happy with that, because I think it would take about that much time, since they probably already have the information compiled because they have to make those decisions themselves. It's irresponsible of us to assume that they don't already have this information. It's just about putting it on a website once a week.
Okay, so from that statement, you pretty much stand by your original motion. Okay, so I had a motion, an amendment to this original motion by Mr. White. I had a second. So we will vote on that amendment by Mr. White. All those in favor? 3. Okay, that's 3-4. All those opposed? 2, 3. 1, 2, 3, 4. Okay, I can't count. Y'all in the wrong place. Okay. So that amendment to it. So we go back to the motion. And the original motion, do you want to read it again? Or do you want to read it, Erin?
Reallocate resources that we currently have to create a weekly data dashboard/website to create numbers by school to include active COVID cases and staff. That was the original.
Is that correct?
And then with the amendment of,
Of,
Yeah, the amendment
separately
passed.
reporting
Yes.
5 teachers and staff.
So that'll now go all part of that one motion, right? Since that amendment to that motion passed. Okay. All right, all those in favor of that, raise your hand. 4, and all those opposed? 3. Okay. I would like to put a positive spin. We do have vaccines that we pray are effective and have started, I don't know when they'll get to us, but at least that's good, and I sure hope this is all very temporary. And, Dr. Milton, I'd like to say, one of my ideas, and I don't know if this is the place to say it, because we want to hear what you want, but I do want to say, as a board, I totally agree, in principle, if we need more resources for nurses, or for, it just wasn't specific to that, to the motion that I just voted for, but I do think we could even look at it, and I think we discussed it before the new board was here. Mr. White will remember, we talked about, and Mr. Lois, possibly temporary services that wouldn't add to FTEs and would not, have, benefits. And there are people that want temporary service, and they could help in our schools, and they could help, their nurses that have retired that possibly would take a temporary job. So I just wanted to say that, because I know we're stretched, but I would like to see if we can come up with that within our own data. So with that, Ms. Hines, I'm gonna go back here to your original question to Dr. Milton, what she needs. Any other question before we take them? Okay.
I just wanted to reiterate what she said, and I think what I may say it slightly differently is, if you need more resources for nurses, if that helps with the tracing or the administration and allowing the teachers to be, and the students to be safer in the environment, then, I think we can look at it for this year, because we can assume that maybe things are going to be different next fall with the vaccine, and that, please come back to us if that is something that is a needed component, because what's at stake here is too much to risk by being penny wise and pound foolish when it comes to trying to bring safety and security to the staff and the teachers and the students.
Ms. Hines, or with Ms. Logan?
I have a little bit of a statement, I guess. I'm a little confused and taken off by what just passed, and that's okay. And then the subsequent statements, because it seems like we're saying we're going to reallocate resources that we already have to create a dashboard, and then we go and say to Dr. Melton that, well, if you need more resources or nurses to help you with that, then just let us know. And that's really why, I didn't feel comfortable voting on reallocating resources, because I need a little bit more information to say, can we reallocate resources, other than to say, you need to do it, and then there not be a way to figure it out. That's just my concern, because I don't wanna, there's a lot going on and a lot of moving parts throughout the district, and I just think that in order for us to be responsible, we just need to make sure that we do have those resources that we can reallocate. It seems like it would be easy to just create a Google workshop, or a Google spreadsheet, and throw the numbers in, and that would be the dashboard. And I don't know, I'm not tech savvy, so I don't know about that. I mean, high school students might be able to, and I can, and that's okay. I just don't have that information. So I think that when we're voting on something, we just need to have the information.
Well, what I'd like to respond, the idea of nurses and staffing, where there's so many people out, to me is a different matter than the numbers. So to me, it's totally different, but I mean, and that's the great thing about a board, we can have different opinion on that.
Absolutely.
But, and if we see that, I voted in favor of that motion, if we see that that's impossible for them to get to us, then we can revisit it. But to me, that's more doable than staffing a school with a nurse or with somebody that's, or even an assistant principal or a bus driver. We certainly would find emergency funds for that, because that's the safety. Reporting this, to me, I don't see it. It's more of an emotional, information, community thing. So I see it very different than you, Ms. Hunt. Anybody else want to comment? Now, we want to hear from you. Oh, Matt, I'm
It's a
sorry.
similar statement, and it goes back to allocating resources that I wasn't comfortable enough knowing where those resources were gonna come from to create a dashboard. That I feel if we had a little more clarity coming into it, it might have gone a little differently how the vote wrote. But aside from it, make that notion that Mr. White reiterated earlier and Ms. Blackburn-Hines said a minute ago, it comes down to the safety and security of the staff, the students. And I think we can all agree that there's nobody taking a stance that we need to cut anything dealing with safety or security. More so it's where is it gonna come from? And I do understand that the process to gather this data, it appears simple in theory, but I understand that we've got 23 schools and 17,500 students on rough, to pull this data from weekly. So I understand that Dr. Melton and her staff are stretched thin. That's it.
Thank you, Ms. Stokes. Now, you get to do your thing, and we're gonna be quiet.
The conversation is rewarding, Ms. Hammond, that this board has this kind of commitment with questions and feedback. So to echo what all of you have said in different ways, what I believe is to be anxious about nothing. And people that believe what I believe can cite where that comes from. But as I look towards the thing that I am concerned or anxious about is the supervision and the safety of our students operationally at this time, and of our staff's well-being that are losing planning periods, that are taking on other responsibilities as support staff specialists to cover classes. And we can't forget that there is a COVID threat, but there's also the daily physical environment that we need to manage and supervise. So if there is an emergency, whatever that may be, I need assurance, and I suspect you all would want that same assurance, that we would have the adult supervision doing the things that they need to do to assist our students and to protect our school sites. And of course, that would be inclusive of district office sites as well. So as I look towards where we are currently, I have had many conversations, and I'll use last Monday as an example. Executive staff and I met with a reentry focus to include other important positions with our executive staff conversations, and then that was from 8 until noon, and then another meeting that started to include principals, and we layered in principals from 1 o'clock until nearly 3 o'clock last Monday. So if nothing else, I hope that sends a message to this board and assurance to our community that we do reprioritize and that we do make sure that we focus on the now, because the what that matters is the safety of our staff and the safety of our students. Of course, the instructional purpose of this district stands secure, but we've got to have a mindset as administrators to make sure that we're looking through a variety of lenses and through a responsibility angle of every decision that we make. So last Monday, we spent unscheduled time with principals, pull them into meetings that they did not have on their calendars, in addition to the ones that they'd already given recently, so that we could extend this conversation. And then today with executive staff, you heard me mention earlier our schedule today, so I'm at the place now, if I were to have the responsibility to make recommendations to the board or report to the board of where we are, I do believe that we need to start looking towards an adjustment. I think I heard a board member use that example earlier of adjustment of where we currently are, because our 4-day of operation, if you go back and look at the slides with that mark of time that was noted on the slides, that we do have a reason or a pause to look towards what needs to be done. Where I'm struggling is with an adjustment. We know that our families need consistency. We know that as we have brought students back at PK through 2, 3rd through 6th, 7th through 12, we've created some phases of cohorts in a sense of how we can prepare this. So I would be prepared to make the recommendation this evening, Ms. Hammond, to look towards Wednesday is already a day of virtual learning in School District 5. You all very much know that. But if we look towards Thursday and Friday of this week, I would look towards adjusting towards a hybrid schedule for our 7th through 12th grade. I'm specifically more concerned about 9 through 12, but for the continuity, it's my recommendation to look towards 7 through 12. If we make that adjustment and have that B cohort come on Thursday and Friday of this week, and then the A cohort the following week of Monday and Tuesday, we could balance it out before the winter break. But then the second part of what I'm looking towards is the 16th of December is already a virtual day. To use Thursday the 17th and Friday the 18th as distance learning days district-wide. That would allow Ms. Stanek and her team and our school teams the opportunity to look towards any contact tracing that we could make sure that as staff gets ready for, and families get ready for a winter holiday that's ahead, that Thursday the 17th and Friday the 18th, that we can be operating through distance learning model to get the information and to share the information that we need and offer an extension of how we're operating. So Ms. Hammond, I'd like to make sure that that's added, but to make sure that I recap it once again. Wednesday of this week continue to be our virtual learning as you all have known us to be, but Thursday, December the 3rd, Friday, December the 4th, bring our B cohort of our 7th through 12th back, but you heard me say that 9 through 12 is a higher data points, maybe than 7 and 8 inclusive, but if we keep it consistent with groups, that will be 7 through 12 go in hybrid, the 3rd and the 4th with B group, and then Monday and Tuesday, 7th and 8th, the A group would return on campus to start our hybrid operations. And then part 2 of that is to have distance learning the 17th and 18th of December district-wide.
Dr. Milton, I have a question just about, you use the term continuity to add in the 7th. I'm not opposed to that, but since I teach middle school, I almost think the 7th and 8th need to be in class. In other words, 9th through 12th, now I'm just speaking as a teacher now, but 9th through 12th really do better than younger kids with virtual. And even though 7th and 8th, they think they're grown, I have seen such a need with my 8th graders to have, the daily grind with the teacher. However, I'm going to acquiesce to your reasoning. But if it was just continuity, I would like to just answer, could we possibly leave 7th and 8th, not include middle school, but it just be high school? Because see, they can't get in the car and drive somewhere.
Yes, ma'am.
We know what high schoolers can do.
Yes, ma'am.
But if it will really hurt your logistics, I wanted to hear.
Our logistics, no ma'am, our transportation, nutrition, and school teams have shown, I believe, hearing from our 7th and 8th grade, and Ms. Hammond, you know this as a middle school teacher, that the class changes, the socialization, the interaction of students. At what point do you say you use the data? Continuity, I think, does matter for a sense of awareness as to what's going on. I agree that our students are more successful when they have that direct interaction with our teachers, but the conversations that I have had, the information that I've received from principals and teachers that I've had the opportunity to hear from and interact with in their schools and other platforms is the concern of the uptick. And of course, with last week's holiday, if you pay attention to trends that are being projected in our state, the potential upswing of what may happen. So at what point do we try to be proactive and preventative versus reactive and expose? So that definitely is something of consideration. And because I'm not quite sure how to navigate this involvement with the board, I wanted to make sure you all heard from me that the 7 through 12 piece, the 9 through 12 piece, and what this board, how they may react to that.
Thank you. Any questions on that? Yes, Ms. Gardner.
I guess the question I have mainly is why is this, we only have basically 2 weeks of school left if we use the last 2 days as distance learning days. Why the push for removing, for changing everything when, and here, I'm gonna say this is my, this is opinion based on Nikki, but our children are not getting COVID. They're getting quarantined, but they're not getting COVID at school. In fact, the CDC and even DHEC has said this, and even all of us around here have said that the safest place for a child is the high school. It is at school. And if our high school students do have the ability to drive, and they do have the ability to go to work and to have fun and to go do other things because they're not in school, why is it safer for them not to be at school? It's safer for them to be there. It's safer. So I guess what I'm saying is I would like to challenge that we do what our own board policies tell us that we're doing, and what we stated that we would do as board members, that we would put the children first. Because allowing them not to be in school is not putting them in the safest place that they need to be. Canceling school only allows them to have more access to more people. And that the reason that the numbers are going up right now is not because we went back to school. It's because it's going up in our community. The spread in our community has gone up. So of course it's going to go up in relation to that also at our schools. And in order to prevent that from spreading, the best place for those kids to be is in the same classrooms every day with the same kids. So I do understand, the need to do what we need to do to mitigate, but we have to trust our own mitigation factors. We have to get our teachers to trust our mitigation factors. We have to get our staff to trust it and to use it, and make sure that we've educated and or disciplined our children enough, our students enough, to where they will also trust those factors and use them. I'll just tell you, like I said, I'm getting all my information outside of the school board because I'm not receiving it from the administration, but what I'm receiving are hundreds of emails from high school teachers because they don't feel safe. But the numbers show that the elementary school are the ones that are being quarantined in droves, but I haven't gotten but maybe 2 or 3 emails total. Those students, those teachers, the faculty, the staff, the parents, they're not as upset as this, cohort of high school students, teachers who feel unsafe. And I'm not sure why they would feel more safe if they knew that the students that they were in their classroom had been more places and had the ability to go and do more. And I'm just going to say this too, is if we think that coming back in January, everything's suddenly going to be rosy after we've all been gone for 2 weeks, traveling and doing whatever we've been doing, we're kidding ourselves. And that now is the time to be in school, so that when we come back in January and it is flu season and or things are getting worse, that we can look back and say, I'm glad we stayed because it's much worse now. And I've been saying that all along. I thought we should have gone back to school in September because I knew that the community instances were low, and so we could have gone back to school and kept everything low. And now that it's ticking up in the community, it's going to tick up at the school, but it's still not at a position, it's still not at a place that's scary. But we just need to create the environments that the teachers feel safe. And that's where our problem is. It's not because there's so many kids that have it, it's because the environment feels unsafe and because of the quarantine numbers are out of control. Those kids who are quarantining are going home or going and doing stuff because they're not doing school. They're not in school. And our kids, I have an 8th and a 9th grader, and I can't tell you, I think my 9th grader would be fine. They should just be, hybrid, but my 8th grader should be in school. It's not fair. I can't use that logic because in my eyes, they all should be in school because that's the safest place for them to be, and that's where they should be. So I don't even want to make a motion that says let's split them out because I don't believe that would be being two-faced on my part because I think they should all be in school. So, but.
Thank you, Ms. Gardner.
And Ms. Hammond, if I may add, I agree with you, Ms. Gardner. My concern is about the safety with supervision. And when you all look at the slide for teacher absences, we are having schools that are struggling to find that class coverage because of the number of people that are out for a variety of reasons, because surgeries are still occurring, sickness of children and themselves are still occurring, and then you compound that with quarantines and other things, and whether it's a mental health day that someone has reached a saturation point because they've covered for so many other people throughout the week, or they're fatigued and are taking a day off to be at home to work from home because they're a support position that can't get their job done during the day. So as a point of clarity or emphasis for me, it is safety that I'm concerned about and the multiple people that are trying to manage this jigsaw within every site of moving people around, and people that are reaching a place of frustration and overwhelmed commitment that they are compromising their own wellness, whether that's mental, social, or physical, because they're extended to cover for so many other people to keep the operations going. That is of great concern to me.
Dr. Milton, let me ask you, I agree with someone who said that the majority of our emails were from Chapin High as the most, I mean, that's what I heard from the most of problems. And correct me if I'm wrong, there were a lot of administration that was out, which I understand your point. Is it that dire situation at all the high schools, just looking at the high schools, or is Chapin really unique with a greater problem? And I'd like to know that.
Yes, ma'am.
Or looking at this, this blanket plan.
That's where I'm gonna go back to what I shared earlier about the advice of legal counsel, Ms. Hammond. If I specifically called out a subgroup or subset within a school, then that could be of concern legally as to what I would say. So could I say to you that we've been monitoring per site? Yes, ma'am, I could say that. Could I say to you that we're reaching a place of identified sites that we may need to operate differently? Then that would be something I could say we have considered and reviewed. And then we get into the discussion of equity and how are we going to operate? What's that statistical balance to keep things in operation? And where are we looking at holistic? So we as an executive staff have strengthened our interconnections because we have pushed back to think in different perspectives. And we're at the place now with the committees that we're working with, and I'm in a place that what I bring to you as far as our recommendation that I can share with you, that it's been thoughtfully considered, and this is my recommendation. I would like for Ms. Stanek to have an opportunity to share, because Ms. Garner had a question that I think needs to be explained. It's a great question that gives us an opportunity, Ms. Stanek, from a communication with the external community and internal as well. The need that we would have if we were to have Thursday and Friday, December the 17th and 18th, what that would look like through a school nurse lens and through the connections that you and your teams at our school sites need to do to make sure that families are aware and staff is aware and prepared.
So if we were able to have those 2 days prior to the winter break as virtual, it would allow us to appropriately contact trace. And basically, what I mean by that is when we're contact tracing, when we have a positive case, we take a 48-hour window around and look at the people that were around that person for 48 hours to determine who is a close contact and who is an indirect contact. So and the concern is we would be about to go on an extended break. The school is going to close down. We're still going to have positive cases popping up on a Thursday and a Friday and a Saturday and even that Sunday that would affect that Thursday and Friday. We would not be able to efficiently identify and safely identify the people on that Friday who are considered a close contact. And so that impacts the health of the community. I mean, it impacts the health of our students and of our staff, but it overall public health. If we have people that are considered close contact and we can't make them aware of that, it's going to impact the public health of our community. And that's why it would be really critical to have those 2 days where the students were not together, so that when the positive cases come up, we do not have close contacts in our school that we're not able to get to and notify.
Thank you, Ms. Daniel.
had a couple of questions, but I'll go last.
Ms. Hammond, I'm sorry to interrupt, but I've had 2 or 3 people contact me and say they can't hear you on live stream, or Nikki. If y'all can speak up
You
more
know,
to your
is it
microphone.
this that I'm talking in?
No, the microphone,
Microphone.
you need to pull the microphone.
Oh, guess what I thought? I'm back. I thought it was picking up there. I'm so sorry. Thank you, Mr. White. I appreciate it. Can you hear me now, you think? Is it on? It is? I don't see the little light, but I believe you. I appreciate this hard conversation. Where I stand is I feel exactly like Ms. Gardner. As a teacher, I do know that the most important thing is to be in school. Where I am conflicted about the needs that Dr. Melton has brought to us is the staffing. And I don't know, and this would be good to me, to what we've asked for and will be getting, but to know if every school is in dire need of staffing to a point that there are not enough teachers to do the teaching that I know should go on there, but they're not there. Administrators that aren't there. I had some emails about cafeteria workers that were not there, and I would really rather we go on with our plan without any readjustment. I know that's best for students. Trust me, it's best, and I believe in the herd immunity. I really do. And I do believe that we are having the problem not from sick children or parents or teachers, but from people that are quarantined. Because like you're saying, all of a sudden you could quarantine 10 people. So I guess what I really am saying to the board, because we're going to all have a different opinion, but it's important, all 7 of us are equal. If Dr. Melton could help me understand there's no other way for this staffing except to do this. And I guess you feel like with less children there, and I'm doing this, we're AB right now, and Wednesday all my kids will be back in class. And I know that I'm going to have to work harder as a teacher to keep my 8th graders when we go to lunch. Like right now, I just have half the kids. So I truly can keep them more apart. They sit in the lunch room apart, like this. Now we're going to have them all there. But that is my job. And that is the job of the administration. And I hope there are none of our schools that have different leadership styles that allow more things to go on than should. And that, or they can't help it, kids are going to mess up. But that there's consequences in place for any kid that does what I'm hearing of sneeze balls and thinking it's funny to see how many people they might make a guess who's going to get COVID. And y'all, we have to understand the mental developmental stage of a teenager. They're going to do silly things like this. So I'm really, one question I have, Dr. Melton, is how is this readjustment just till January?
Ms. Hammond, I'm very hesitant to what I commit to, because with every update that Ms. Stanek receives and she relays to Dr. Harris and me, with every update that others that I've identified this evening receive, am I hopeful? Absolutely. But as I look towards an extended holiday vacation and not knowing how many in our community are traveling or hosting visitors, it's difficult to predict what may happen. But can I share with you that we're trying to be as proactive and responsible, yes ma'am, as we can be. I believe that our staff of every position is working as hard as they can work to create a safe environment where children can learn and where they can perform their responsibilities as School District 5. So I'm not looking ahead with any recommendations. The last meeting, you heard me talk about February, trying to get back to 5 days. And then here I am from November 16th till today, approximately 2 weeks 2 weeks as of tonight, bringing you a report of an update that differs from what I was hoping for 2 weeks ago. And of course, 2 weeks ago, we were in a different place of phase 4 implementation of having 7 through 12 back 4 days a week. So I continue to look towards the future using a variety of data points and leaning on a variety of experts who have proven to be successful in their positions, that have qualified opinions and practitioner experiences that I can lean on, and conversations that we can have for the well-being of our staff and also for our students.
Well, you can answer this, or maybe you don't have the information. Other schools that have been back to the 4-day, and some that have been in 5-day, is there anything they're doing not to have as many problems as we seem to have about with so many quarantined? Do you think they don't? Is there any answer of something else we could do? I guess I'm asking.
I think it depends on who you talk with, because our reentry started at a different time than some of our neighbors. We've had some neighbors that continue with virtual longer than we were because of how we phased in our PK through 2, 3rd through 6th, and then 7th through 12. So if you look towards different sizes of districts that may have more of a contained community, that may not be out traveling, that may be more boundary-based. If you think about our community, we're so mobile. Although we have clusters of attendance, look how much interaction our community have inside of School District 5 and outside of School District 5, as compared to some districts that may be more rural that have that more of a community that doesn't necessarily have more engagement outside of the, I'll say, boundaries with air quotes. So I think this is about being respectful of districts as to the culture and the climate. I think in School District 5, we've taken advantage of the resources that our State Department of Education and General Assembly have offered. Of course, we hosted a conference that Superintendent Spearman held just a few weeks ago at River Springs Elementary because we took advantage of some of the resources that were executed by the General Assembly. So do we compare notes? Yes, ma'am, absolutely. As superintendents in the Midlands, but also superintendents across the state. But because there's been so many different variables of how districts have started back and the different sizes of districts and the different variables within the operations, I don't know that there's one solution that others have tried to be successful that maybe we haven't. But I can tell you that we continue to interact to see what others are doing and what we may be able to consider for our improvements.
Thank you. Ms. Hine, was your hand up?
So my concern is, I'm just going to be clear. I have a student in our schools. She's she's in elementary school, so it's a little bit different than the high school model. And I very much understand and agree that our students need to be in school. I absolutely agree with that. My child, and I know many other children struggle on a virtual platform. It doesn't matter if they're in elementary school or high school. I know that there are those struggles. And I would like to see that happen. Period. I would. But I also understand that in order for our kids, or our students, to be successful in school, they have to have teachers there. And they have to have teachers that are not constantly playing catch up because there's so many different moving parts. And it's different in an elementary school environment, and I think, Dr. Melton, you recognize that just by what you're presenting to us tonight. We're not talking about adjusting an elementary school schedule or an intermediate school schedule. We're talking about more, I think, the high school schedule. And I have had several conversations with teachers in the last week. And I would like to say that I've had several conversations with teachers that really feel like they cannot believe that they're saying what they're saying to me, because for months they've been saying, we need our kids back in 4 days. They need to be in now. It's not working. The 2 days in person and the 3 days virtual is not working. We need to be back in 4 days. And they've been saying that for months. And now we've been back in for 4 days for the last 2 or 3 weeks. And they're changing their tunes because you have grown, high school students are not grown, but physically they may be closer to grown. So when you're putting them into a classroom, they're having a hard time spacing. I know in elementary school we're having a hard time spacing, but in high school we're definitely having that issue. And, you know, you could go back and forth on, I see the numbers. I see we have 20 positive cases in District 5, and that gives me pause. Okay, well, that doesn't seem like that many when we're talking about 1,700 students. And again, I know for the fact checkers out there, we have people in 5. I'm just rounding up. It doesn't seem like that there's that many positive cases. But when you start looking at the individual school numbers, and that's kind of what we were talking about when we were talking about the dashboard and seeing the numbers. When you have, you know, a certain number of students that are constantly rotating out of quarantine in the high school situation, and the teachers are having to adjust, you know, making sure that they're getting the right information to be able to learn at home while they're on quarantine, even though that they're healthy. And then you have your class that's in person that you're trying to teach, and then you have your virtual day on Wednesdays, or when we switch back, you have your virtual days. It is a lot. We are asking a lot from our high school, from all of our teachers. I don't want, you know, from all of our teachers, we're asking a lot. I mean, and we need to recognize that, and I think that we do, but sometimes I think that it's easier. I'm a mom. I want my child to receive. I'm worried that she is, you know, struggling because we've been, you know, her learning schedule has been pushed back, and, you know, she's learning how to read and do math and all of that kind of stuff. I get it. My concern at the high school level right now, after speaking to these teachers that are saying, Rebecca, we wanted to be back in 4 days. We were the ones pushing, and I'm hearing from some of them that are saying, you know what, maybe for right now we need to step it back because we don't have the systems in place. The plexiglass on the desk are not big enough. It's not, like, that's not working. We don't have enough time to wipe the desk down between classes. Our classes they're rotating in and out. It's not like it's not a family unit. There's community, you know, the students are moving around. We're seeing pictures of students sitting outside at lunch tables because that's what kids do. I don't blame them for that at all. But the teachers are watching this and they're feeling like, I mean, they're uncomfortable. They're older. Some of the teachers are older. Some of them are younger. We're just hearing so much of that. And I'm hearing that we have so many of our teachers that are considering taking time off because they can, because they have the time to take off. You know, I understand a lot of teachers collect time and they don't use it all at one time. Well, they could do that right now. I don't know if they're doing that, but I have heard the chatter. And that's something to take into consideration because we cannot have our students in the schools if we don't have the people in the schools. We don't have the subs. High school teachers are covering for each other. There is not a planning period. And it seems like we're putting them in an impossible situation. So I don't know what the right answer is, and I can't, you know, I know that being in school is the right answer. I want us to go back into school. I don't know if if we were to agree to this, when we go back in January, we've adjusted a little bit of what we're doing. Like, should we stagger the class time so that there's not so many kids in the hallways? Should we figure out why the plexiglass isn't working? Should we give new masks to students as they come in? Should we have teachers stand outside doors and wash? I mean, I'm not trying to add anything else. I'm just saying, like, I don't think that it's working right now from what I'm hearing. And I also have talked to some teachers that think that it is working. You know, it's not, you know, I think that there's a healthy divide there. Not a healthy divide, I don't know if that's the right word, but there is a divide there. But at the end of the day, the teachers that feel uncomfortable, if they're not there, we're putting ourselves in a very dangerous situation. We have to have the people there. So that's just my 2 cents.
Ms. Hines, no, I appreciate all of that. I would say, though, we as teachers do monitor the hall, and we make them walk like a Superman. This is 8th grade now. I'm not saying high school.
Right.
And it depends on how strict your teachers are with the protocol. But we do that. We stagger it. I mean, it's almost everything you said. The teachers are doing that. And the plexiglass.
In our district.
Well, I bet ours are doing that. Surely they are. But here's what I want to ask. and it goes along with some you're saying. The AB schedule, Dr. Melton, how is it going to solve the teachers being out? Because it really, I don't see that connect.
Yes, ma'am, and I appreciate the question. Mr. Giuliano, I'm going to ask you to come and assist with responding to this, and as he transitions to the microphone, I think it's important that I add a caveat to Ms. Blackburn-Hines' question. Depending on the schedule, and I'll give an example, if we have a bus that's going to be leaving a high school to go to the center, we cannot stagger that bell schedule because students need to get to the bus or transportation to get to the center, so that those that are there can be transported back, and then those that are going to the center can be transported there. So when there is flexibility, there is some of that juggling as you're describing, or managing that. But in other situations, if you adjust bell schedules too much, you're going to have the problem happen anyway, because students will be lining up outside the door without an adult supervising them, waiting for that previous class to exit a classroom because we're trying to stagger one hallway or one part of the building. Because secondary students do not move in units, any staggering we do is not necessarily going to negate the problem. But the way we have authorized our school administrators is to be mindful and observant, and where do they need to have the flexibility. I'll give an example. We adjusted the feeding schedule of our meals on Wednesdays because our 5 teachers gave us feedback that the window for meal pickup was conflicting with their schedule for instruction. So we as a system revised that. So when we have that kind of detailed information where there is a solution, we adjust real time to make that revision for the very next day. In other situations, there isn't that flexibility. Mr. Giuliano, in response to the question that I have intervened to give some context of others, I'll ask you now to respond.
Thank you,
Do I need to
Doctor.
repeat it, or you heard me?
You can repeat it if you'd like, or.
I was just thinking, explain to me how, I know AB keeps the students' number at the time they are smaller, I know that. But if one of our main problems is staffing, and the quarantine, how would AB, improve that?
So certainly, we're talking about the middle and high school level with the change to the hybrid model. So you'd have about half the students in the building or in the classrooms at a particular time. So of course, now you could increase your distancing in the classroom. You could increase some of the other components with less people in the cafeteria or moving around the building, going to different classes throughout the building, less people in the hallways. So you're going to have certainly less contact with students and with staff too, because there'll be less staff. So you're able to spread out and change some of that as well. So it's a lot of it has to do with the distancing.
You'd have the same number of staff though, whether it's AB, they come every day.
Oh, I'm sorry, yes, I misspoke there. So the staffing would be at the elementary level, but this is for the middle and high school. Correct, so it would be the same, the staffing would be the same, but you may have staff members that have less kids in the classrooms.
So, for example, if I am scheduled for the B cohort, I may have an available block that may not be open had the students been on site. So going back to a hybrid model of AB and the AA and then BB, that's going to help free up some of the staff. That may mean more of the virtual experience, but at least it gives us fewer students in a building that we can make sure we look through a staffing lens of what available staff do we have, because we're not supervising double the number of students that could be here with the model that we're currently operating. Mr. G, anything else you want to add for clarification to that?
So for example, if you had possibly 20 kids in a classroom, now you're looking at approximately 10 per classroom. So the size of the classroom, of course, has stayed the same, but now we can spread them out more. So if you take 10 per class and now they're in the hallways, you have less in the hallways at a particular time that are moving about the building in other locations as well.
But to the staffing, you could still have the same number of staff members that have to be quarantined, even if there are less students there. I mean, I see that you answered my question about distancing. I get that.
Sure.
I'm just saying, I'm trying to, because the glitch for me is I want to know we're staffed. I want to know the teachers are there. And so I get it about half of the, that you're gonna definitely be able to keep the kids more apart. But I didn't know if you do that, then you're gonna have less people sick. You're gonna have less teachers and staff sick, correct? That's the way you look, that's our assumption.
Well, we are hoping, and, looking at the previous operations before this 4-day model,
Yeah, that's a good question.
we had coverage of classes differently than we're strained at this point to cover classes. So if we were to go back and pull the graphics up that Mr. Holden spoke to earlier, we were not having the coverage issue that Dr. Turner has been concerned and Mr. Holden has reported this evening because of the current operations at that time of that phase. So with the current phase that we're in, the number of students we have in the building, it's our concern about the staffing of the physical students on campus that we're.
I got you.
Yes, ma'am.
So it's the same amount of staff, you answered my question, dealing though with half the kids. So you can spread out your staff in a way. Like say you if you need an assistant principal going here and there, you're just swamped right now while they're there 4 days.
And I appreciate the example of an assistant principal, Ms. Hammond, because if there is a 4-day model in place for school ABC, and we have X number of students on campus, and if we were to decrease that to in half, that admin team could be used, or that facilities team, or that nutrition team, or that transportation team. We would have more flexibility to move around support staff support. It would also assist, of course, with our nurses and the reporting that they're doing. They would be still engaged with families and students that may be participating virtually, but there would be fewer on campus that we would need to trace and more of a window of time for that identification, that they could alert that family rather than immediate, come pick up your child now. That still will happen in some situations. But if we had students on a campus Thursday and Friday and they weren't there on a Monday, then that nurse would have more time to reach out to that family to get them prepared for their adjustments, not to return to campus on Thursday. So that would help with some of the stress that I heard Ms. Gardner reference earlier of the awareness of teachers and staff and knowing what's going on around them.
Thank you, that was my answer. That was good, Dr. Milton.
And Dr. Mel, just one last thing just to add to that. A lot of times the quarantines are based upon close contact.
Thank you.
And our teachers are being quarantined because of close contact within the 6 feet for an extended period of time, up to that 15-minute threshold. So if they are allowed to be 6 feet apart, you're going to have less quarantines.
Thank you.
Yeah, and I think, that was the point I wanted to make, and one of the teachers that sent us a note, if you got 10 kids in your classroom and you got a confirmed case, maybe the teacher's not going out on quarantine, but when I'm giving an example, somebody on the front row is a confirmed case and the teacher's going out and being quarantined because they had 24 kids in the classroom and everybody's 3 feet apart.
It adds to it.
And I had another lawyer explain to me who represents school districts and represents private schools, and said the most successful schools so far that have gone back with some variation of face-to-face have allowed some spacing or alternations, and it's the rush to go back too quick that puts people in close contact too quickly. And then if we're going to follow CDC guidelines, everybody's got to go out for 14 days. One of my concerns is, and I think I've seen some of this in the notes we've gotten too, is, we want kids to go back face to face. We know parents need it that are working parents. We know kids need it for their mental health. They need it for their academic achievement. But if they're getting, it can be worse if we push them back too quick, because if they're rotating in and out of quarantines, it's still going to be disruptive on the parents. It's still going to be messing up the kids' psychology, and it's still going to be interfering with their learning. And that the most successful schools that are doing this are easing into it. They're not trying to do it all at once, and they're staging it in. And I think we need to let the people who operate our schools, tell us what's best for bringing everything back online.
I just need to say that Ms. Huddle needs to ask a question, but I just have to say, I don't think we rushed this. We waited and waited and we phased it in, and that's.
No, but the 4 day.
It's possible to say that we rushed into
The
this.
4 day.
We have not rushed into
The
anything.
4 day, the AB brings, it brings smaller crowds in the building, and the 4 day.
Why is it different for
increase.
elementary than high school? Why are we talking about two different things here? Why is nobody in the elementary school?
Well, I can tell you what,
It
the
is for
teacher
elementary
that,
Because it wasn't too fast, but they went back sooner.
Let's do
The
one
teacher-
at a time.
Nothing to do with it. It's community, the community incidences have gone up, so they will in our schools too.
but
That's what's happening.
one of the teachers that communicated us said the difference is, number one, the kids in the elementary school, they're stationary longer during the day. They're not moving around, changing classes. They're not as social at that age. And then the second thing is, it's what they're doing when they're not in school,
That's
and
why
they're
they
bringing
need
it back to
be there. It
school.
only confirms what I've said, and I think you need to ask.
Okay.
Ms. Huddle's had her hand
I
up.
know, we're going to Ms. Huddle, and I appreciate both of your points, but I want everybody to be able to hear both of you, so we need to talk one at a time. Ms. Huddle, I've been looking up there, and I just saw your hand, I'm sorry.
That's quite all right. I will be very brief. I just want to, I guess, reiterate that personally, I cannot make a decision based on this data because we don't have it at the school level. And my impression from the emails and phone calls that I have received is that we do have a problem at Chapin High School that probably does need to be addressed. But I don't know that because I'm not seeing the data. And I heard someone raise the issue of equity, but I would say to you that if we had a major outbreak at an elementary school, I'd like to think that we would not shut down 11 other elementary schools. So I just want to, make that point.
Thank you, Ms. Huddle. Mr. Lovelace, are you all right up there? You haven't raised your hand, but I just want to be sure you were there.
Well, I mean, my take on it is that we haven't heard one thing about what happens and what parameters dictate going back to 4-day face-to-face if this were to happen. And we haven't heard anything about non-standardized, we don't have a standardized method of teaching virtual delivery in our whole district. Yet we're gonna go turn that back over, to somebody. Sounds to me like, this one size fits all. And we're just gonna go, because the lawyers told us to lawyer up, we're just gonna go make all the other high schools do it because Chapin High School has a problem. And I don't think that's the right thing to do. And I think we need to get the data. And I think you need to bring it back to us and show it to us. And all this other stuff that you're talking about may or may not be true, but those are my takes on it, so thank you.
Ms. Hammond, may I ask for a point of clarity? When I hear Mr. Lovelace say lawyer up, I've alluded to a couple of times about the use of an attorney for some of the statements that I've responded to, but we have not sought, and I don't know that that's what he is referencing, but we as an administration have not sought legal advice about the operations of our schools. The recommendation that I'm bringing forth to the board tonight is my recommendation based upon experts that we have employed in School District 5 that report to me and through the structures that I had developed as superintendent. So if that were, I know Mr. White referenced a conversation that he had that, for point of clarity for that was not at the expense of School District 5 using a School District 5 approved attorney. So Mr. White may have personal connections that he has sought as legal counsel of his own professional field of expertise, but School District 5 has not used legal advice for the operations of School District 5. However, we have sought legal advice to make sure that we are protective and compliant with help information, with our responsibility of operations, but we have not sought guidance of a legal counsel as far as any recommendations for operations of School District 5.
Thank you. Ms. Hines, Blackburn Hines.
Dr. Melton, point blank, do we have a staffing issue at our high school right now? If we don't vote to approve this plan, do we have an issue where we are going to go to school on tomorrow or on Thursday and we don't have the staff there? I know that I hate to ask such a direct question, but I understand all of my colleagues' concern about the numbers, and I get where Ms. Huddle is coming from. It's hard to make a decision when we don't have the specific school numbers. But now we've kind of narrowed it down to where we're talking about middle schools and high schools, and the concerns that I've heard over the last week really are focused on high schools. But I think that maybe that has changed in the last day or so with middle schools. I don't know because I don't have that information in front of me. My concern right now is the staffing. Do we have a staffing issue at the high school level or any school level? And I don't want to call out a specific school, but.
Yes, ma'am, I would I would caution us not to call it a specific school at this point, so I appreciate your sensitivity to that. I can tell you that I asked principals last Monday, each individually, can you operate successfully tomorrow, meaning last Tuesday. I have been with board officers since 4 o'clock today, so I have not had updates from the staff. I think Dr. Harris left my office at 4:45, so I have not had an update from Dr. Harris, but I would not have asked Ms. Hammond to call a special called meeting if I did not have concerns about staffing. And the bottom line for me at this point is definitely staffing, because of the wellness of our staff, the availability, the strain of our staff, and the operations of School District 5 that depend on staff availability. If Dr. Turner came to the microphone, she will tell you she has explored options to get substitute coverage. We have had parents that have volunteered to come in and volunteer, but that would be a liable situation for us to allow volunteers that have not been properly trained and credentialed to come in. And I applaud our parents for being willing to do that. But it requires a level of training and awareness to make sure that they have the responsibility to come in and assist us with any kind. So we've said to them, if you're interested, we need you to go through Kelly Services for training to be added within this particular opportunity that they could contribute time to us. So yes, ma'am, and I appreciate your direct question. We do have a staffing issue that concerns me.
Mr. Hogan.
Kind of piggyback off that question with the staffing issue that does concern you. Dr. Melton, in your opinion, if we did absolutely nothing, what do you think would happen?
I am concerned about retention. I am concerned about absenteeism. I don't know how many are listening in tonight, but based upon my inbox and yours, and there were some that I received that you all were not copied. There were some you likely received that I was not copied on. We have many staff members at a breaking point of pleading for help and relief of some sort of a change. And why would I suggest going from one phase to another? If you were to go back and look at the phases of reentry, there's an asterisk that we've been consistent to use, and I'll read that to make sure that it's heard for those that don't have access to this presentation. This is a slide of phases of reentry. We've been consistent to share this particular slide. Note, schools may utilize a 100% distance learning model during any phase if needed in response to COVID-19. Phases and dates can be modified contingent upon reentry considerations. The district's flexible, innovative virtual education, or 5, virtual program will continue during all in-person learning models. So that's been a message that we put out there. If we needed to revert, we would make a significant, swift decision. Of course, that was prior to the meeting on November the 16th. But because of where we are currently with operations, it's not my recommendation to you all that we go from a phase 4 all the way to a 100% distance learning. But based upon the communications that we've been consistent to share throughout these updates, that's been one that I've tried to make sure has been visibly drawn the attention of our staff and our community, and of course our parents, because I very much respect the work that our parents need to do to have their child properly supervised, regardless of their age. So, Mr. Hogan, did I answer that question?
Yeah.
Ms. Hunt.
Speaking of piggyback on what you just said about properly supervising our students, do you know what the state law is on the minimum staffing requirements and how close we are to that right now at certain schools?
Staffing is, we look at employment. I'll ask Dr. Turner if she could start making her way towards the podium. We, of course, have what's required for employment in School District 5. The boards of School District 5 have been consistent to support small classroom size. So we've been fortunate by scheduling purposes to schedule classes that are smaller than what the state can allow us to have. So that's a fortune of ours that we've been positioned for. When it comes to supervision, we know that there are some numbers that we need to monitor, and Dr. Harris would have insight on this as well, to make sure that we can operate in a safe environment. Dr. Turner, from your HR lens, what would you like to share to add to that conversation?
The answer about the staffing ratios, I would also reiterate what the Department of Education recommends for class size ratios. Some of those differ based on content level, and so we do operate typically under that based on our own board policy. What I'll also let you know is that as of right now, each day, my responsibility in monitoring the data to ensure staffing and supervision, we are every day running a shortage. Our number of absences are consistently exceeding the number of subs that we have available. So it's two different lenses that we're looking through in terms of that ratio per teacher and our ability to actually cover when those teachers are out and keep those classes within those recommended guidelines.
And Dr. Turner, not to be redundant, but in case this conversation has been lengthy, those absences are not specifically COVID-related only. That would be a typical absence. And if Dr. Harris were at the mic, he would tell you that we've monitored our current day-to-day operations comparing student attendance with previous years of attendance. So we, at one point, up until a certain point, we had not reached a threshold of concern. Dr. Turner is responsible for monitoring that data as well. So Dr. Turner, how many years have you reached back to look at staff attendance and how we're monitoring that?
We started looking back at least 2 years. I'm going to tell you where the data becomes complicated. The staffing formula for this year changed. So even in looking at data up to last year, we were looking at data representative of schools that were fully staffed. So now what's changed is that schools now have some that are at 5. So it's hard to compare. We're not comparing apples to apples here because the population size of the staffing has changed. But we can pull data as far back as we need. It's just getting into what is it reasonable to compare when we look at it.
Put your hand up.
Yeah, question for you while you're up there. You mentioned the absentees, the inability to staff the subs. At what point do we just not open for a day? I mean, I hate to say Thursday, for example, Friday, if we are unable to staff due to teacher absentees, what is the state protocol? What is our district protocol?
As far as closure, and I heard a question about this earlier, School District 5 has shown in historical operations that if we have a power outage, a water issue, gas line issue, whatever that issue may have been, we may need to close one site and operate the others. So if there is any incorrect inference that we would close the whole system because of one issue, I'd like to have, I appreciate the opportunity to clear that up. So thank you for that question, Mr. Hogan. As far as where we are and when we would need to actually make that adjustment, if after this meeting concludes tonight, Nurse Stanek and Dr. Harris give me the update, all this could be reopened for conversation as the night progresses. If Dr. Turner were to share the activity in her inbox, she gets emails from staff throughout the weekends, throughout the evenings. So with every check-in that we have with staff that are responsible for this work, we are getting updates. So there may be, and I've compared this with weather incidents throughout this update from me to the board, that this is like a weather event that we may need to make a one-day decision based upon the variables that we're dealing with. But because of the overlap of some of these quarantines, Dr. Turner can project out how many staff have been quarantined for 14 days versus how many have been isolated for 10. So she and Nurse Stanek work on that, assuming that the employees are well to attend on the 11th day or after that 10 days of isolation, and or ready to return after the 15th day, depending on when that falls. So with any data that we share with you all, it's going to ebb and flow depending on where we are with that window of staff that may be quarantined and or isolated. So with that, Dr. Turner, what have I forgotten in regards to Mr. Hogan's question that you'd like to add to for clarity?
Just the added layer that right now in terms of supervision, what we're doing in schools is when we have teacher shortages in classrooms, many of our schools are pulling on support staff. So we're pulling on adults in the building to provide supervision to ensure that we're keeping our students safe. So as we start seeing numbers creep up, that's a part of this conversation. It's prompting us to have that exact same question that you have. How long can we sustain borrowing from support staff to cover in classrooms and still maintain a safe environment for our students? We certainly don't want to get to that point. So it is a part of the solution that we're hoping to find through this conversation.
And Dr. Turner, to add to that, we've also reassigned some school specialists to assist with other schools that may be having an issue. We've reassigned district administrators to go into schools and be of assistance. We reassigned district staff to go in, so they may be not focusing on their district level responsibilities, but they're in a school contributing to the operations of a school. So depending on how much more we can do that kind of rerouting and assigning for temporary purposes, There may be a time that Nurse Annick says to us, we need to have a day to get our hands around this, because with our closure recently, we don't know how many families may have said, you know, my child's not feeling well today, but it's Thanksgiving, I can't get to a doctor without going to emergency. Friday, oh, it's a sinus infection. Saturday, I'm gonna take them to the doctor Monday morning. So how many are we going to be finding out throughout the rest of this evening and up until maybe lunchtime tomorrow that could be dated, but has just been discovered or identified, and then the results, of course, to follow at some point?
Dr. Milton.
Thank you, Dr. Turner.
And, well, this is probably more to her. I didn't want you to have to go and come back.
Okay.
I was just gonna ask, but it would be to you too. Do we have a staffing problem at the middle schools right now? Same question that I want it specifically to the middle schools, Dr. Turner.
Yes, ma'am. So when we looped together this information for you all, we thought it was important to align elementary and intermediate, middle and high school because of the phases of operation. So if you were to look at that slide that we have offered to you all to be inclusive of middle and high school teachers, Dr. Turner, from your review of information, when it comes to teacher absences to be included by the quarantine information, would you say as of today that there's a middle school staffing issue that would be of concern?
I will say it the way the principals have said it to me. During reentry, when we've asked different levels of principals to give us some feedback on what's happening in their buildings, principals at the middle level and high school level all said that they were coming up with creative ways to provide coverage. So to me, that does indicate that there is still some concern with being able to cover the number of absences in each school.
But do you have the number, like, say, I'm still a little confused, this is one of the things we're going to get, but like per school, you do know the number of absences due to COVID, right? I understand about
Yes, we do.
teachers, it could be other things. Where I was going with this is, if I felt like it wasn't as much of a problem at the middle school, was staffing. And staffing is still my hang up on understanding the need for this change. It matters to me about the middle school, if it's as, because I really heard more from high schools. And I'd like to say, this will make you feel better, I hope, Dr. Turner and Dr. Milton, every school is having trouble with subs. And every school is probably like my school, and we pull people that don't have an actual class. And they help because for whatever reasons, they're subs that don't want to sub because they are afraid of the illness. And they're people that, I just think that's a problem that,
It is.
I wouldn't say we need to change and go back to AB because of that by itself, because that really is true in a lot of schools. But I was trying to look at keeping as many in school as we could, and I do understand the problem with high school more, because in middle school, you do keep them separated when they move to lunch or to class, and they go to classes, whereas high school, you're right, it's not teams, they're just all over the place. And so I was just trying to see if I could keep 7th and 8th graders in school.
And Ms. Hammond, if it's the will of the board that we focus and divide that phase to be inclusive of 9 through 12 and not 7 through 12, that's why when I explained, that's a conversation that we've had as an administrative team. But you all know what the community needs for continuity, for communications. How disruptive would that be if we divided that phase to be inclusive of 9 through 12 specifically and not include middle level? If you were to say, let's monitor it for a week and do 9 through 12 for 1 week and see how middle school is going to go. But in no way do I want to send the message to any of our staff that we're going to continue to operate to put their health and well-being in a situation that would be that they don't feel respected and valued in School District 5. But if that's something that you're looking for some data points, I would say that our most pressing need today, based upon our data, that our variety of data points, would be a focus upon 9 through 12.
And that's what thank you. Mr. White.
Two things. One is a question for Dr. Melton, but I'd like to just make a quick comment. When you talk about staffing needs and the pressure the quarantine puts on staffing, and yes, there is a sub shortage, and there's probably a teacher shortage, and there's probably going to be a bigger one after this year is over with people that leave the profession. But I did have my friend, the lawyer, who actually represents districts, and I'm not lawyering up Ken, I'm basically giving free advice for somebody that's on the front line advising districts every day. One of the things he reminded me of is there was a multi-million-dollar case where a principal basically put a non-certified person in charge of a class, and a student, they were horsing around and breaks their neck and have a multi-million-dollar verdict against the school district. And the point is, we're limited, and the district should be limited in who is allowed to supervise the students at any level. So it's not just anybody can come in the classroom, and this was a janitor that was doing it. So I mean, it has to be, qualified people, and the court basically said you didn't have the professional standards for supervision and that creates liability issues. But the question, and I had an email from a teacher who's a 6th grade teacher wanting to know why 6th grade is not included with the 7th and 8th grade recommendations. This is a teacher that actually got COVID sitting with her students during lunch, and they've changed classes and they do things as well. And I guess the question is, I know you're moving away from 7th and 8th, but I'm getting a question for somebody saying, well, why not put 6th grade with the 7th and 8th and treat them all with that same precaution? And I guess that's for Dr. Melton.
Yeah.
And why you broke that at 7 rather than 6, when they do have some class changes going on at that grade level too.
When we were looking at the initial phases for reentry, we lumped together grades 3 through 6 because of our 2 intermediate schools. So knowing that Crossroads is 6th grade, Chapin Intermediate's 5th and 6th, we thought it'd be less disruptive, and because of developmental needs of what we believe 6th graders to be in August and September. So again, that's some continuity of operations, not to be disruptive, to create a whole new band of students to be 6th through 12. Of course, Irma Middle School has 6th, 7th, and 8th grade, but Chapin Middle School is 7th and 8th, Dutch Fort Mill is 7th and 8th, and then we have our intermediate schools. So if that's the will of the board that we stretch to include 6th through 12, that would certainly be something for you all to have conversations about, but that's part of the rationale as into why, yes, 6th graders do change classes. There's teaming to happen, but at the time of our recommendations, we felt like based upon data, our emphasis was more so as I've described earlier.
Which one? Oh, Ken. Sorry, Mr. Lovelace. See you hanging.
Quite all right. Listen, I read the CDC requirements, and they have an emergency operating plan in there. And it seems to me that, we should have started back in the summer looking for alternative ways to get bus drivers, volunteers, and nurses. And I've heard us discuss one source of substitutes and that kind of thing, which is Kelly Services. And there's numerous, temporary labor services, and as you might be aware, that a contractor would know about. Why haven't we gone to other sources to explore and fill some of the requirements? I know bus drivers, for example, there are plenty of people out of work that don't have, that have CDLs right now. I mean, there's 30 million people out of work in the United States, and so why are we going to one place to look for all this?
Mr. Levis, thank you for the question. I'm asking Dr. Turner. Unfortunately, the perception isn't true. We have sought other places, and as far as contractual engagement, of course, we have had the board brought to the board a few years ago our continued contract with Kelly Services, so that's the primary one that's board approved. But Dr. Turner, talk a little bit about some of the things that we've done to include permanent substitutes, to include the recruitment of those that have retired, to include the recruitment of engaged community members that may have a teaching certification or interest. So talk through some of that recruitment effort so that the board can be aware of some of the things that you and your team have done so innovatively.
Yes, up to this point, we've not relied just on Kelly Services. Our team has identified temporary employees who did not have employment for this year, and we've personally called each of those and offered them opportunities for employment. In addition to that, we've personally reached out to retirees and offered them opportunities to come in addition to different opportunities to engage with Kelly Services about how to recruit additional subs. We've reached out to other districts to find out exactly what they're doing. And as Ms. Hammond already alluded to, the problem is consistent. At this time, there are not a lot of individuals with confidence to come into schools. We do have some who are willing to serve in our 5 instructional model. That is not where we have a need. And we will continue to exhaust options to recruit. But our human resources team has been very actively engaged in recruiting outside of Kelly Services, and will continue to employ different recruitment strategies.
And Dr. Turner, as an extension of that conversation, Mr. Lovelace used bus drivers and CDLs as an example. We have had recruitment of our employees away from School District 5 because they do have that certification expertise. So we've had some people that have sought employment in other places because there isn't the exposure to children or environments where there are more physical interactions, where there can be the security that they're alone in a vehicle to operate successfully. So we're in a competitive situation and try to retain as well. So there's recruitment and there's also retention that I'd like to make sure that we're mindful of. And for those people that have taken on additional responsibilities, Dr. Turner and Ms. Richardson have continued to look towards some opportunities and compensations of incentives that we could make sure that we're doing to be mindful of the work that, that our staff is contributing. Dr. Turner, thank you.
You're welcome.
Dr. Melton, I have a question that in a way goes to my reasoning for this. How many right now are in our 5, our virtual? Do we have a total number that's, because I knew you let people, if I'm remembering right, they could stay in, they had to stay in it till the semester unless they came to you with a hardship. Dr. Harris?
Yes, ma'am. I don't know that we have that number confirmed, so I'll look to Dr. Harris and Mr. G. We did not bring that necessarily. When 5 originally opened, we had approximately a third of our students that chose 5.
Right.
And then, of course, after hearing the interest of the board to make sure that 5 was instructionally competitive and balanced with those that are on site, Mr. Giuliano and team expanded some of the course offerings to make sure that students that chose 5 felt that they had similar course offerings, that if they were on site, that they had not given up that opportunity if they chose 5, so some of those adjustments were made. So I don't know if Dr. Harris has that number that he could report with confidence, but I'll look to him to see. Okay. Is that something that, Ms. Hammond, that you'd like for us to send to the board? We have the 45th day preparing to come with the next board brief that you'll be able to see.
I would like to know that because in my mind, and I'm making an assumption, so you correct me if I'm wrong, but I just know kids. I would think that there were many once we were going back even to AB from playing virtual. They love their friends. They love the social part of school. So I figured we had a large number that did ask. Now, how many? I know you had a set number you could accept. So, but in my mind, that would take out some from our schools right now, that the problem we're looking at now. If some of those that were virtual had just stayed virtual, it would have still, cut down on the number, and that would be their wish, and they would feel safe, and the teachers that chose virtual can feel safe. And I guess we can't keep going back and forth because that drives the teacher crazy because you have to make your lesson plans. But I was just trying to see if there were people, and I know it's a whole nother step, Dr. Melton, but I just felt I have to ask it for parents. If there's teachers that are now more afraid than they were, is that even a possibility to go back to virtual and feel safe at home and teaching virtually, and the kids too?
I think and although I don't have the data in front of me, I'm going to look to Dr. Harris. If we were to say the interest of moving from on-site instruction, whether that was hybrid or 4-day, into 5, we had more students asked to go into 5 than we did to exit 5 to come back on site. Is that true, Dr. Harris? So we had more wanting to go virtual than we had more than wanting to come. So it was not an even exchange. We had more wanting to go virtual in 5 rather than those that wanted to come back on site. So as a district administrative team, we needed to settle, just as you described, Ms. Hammond, teacher loads and assignments, that the windows that we've opened and closed of hardship and request of change of the instructional model, we have been successful in closing that out. Has every family gotten their response that they were hoping for their hardship exchange. Dr. Harris and team continue to look and monitor that. But I can say that Dr. Harris and his team have been successful in placing most of those that have been offered. Dr. Harris, is that an accurate way that although everyone has not been changed, for those that saw an instructional model change, most have had the affirmation that that could be happen? Is that fair, Dr. Harris?
That is correct. And I'll put the word is that most, but not all. That is correct.
Well, Dr. Milton, one other question for me is totally from teachers. If Dr. Turner or you, whoever can answer it better, have we gotten input from them as your team discussed going back to AB and how it would help with staffing? Do your teachers, because since I do this, I know when you go to AB, you're still now teaching virtually and you're teaching in class, okay? So there are teachers that feel, I'm not going to say what they feel, but they're doing two jobs with the same kids. But I wondered if teachers have been asked, not about staffing, not where they have too many in the room, but do they feel confident going back to AB, not putting more work on their schedule?
So I think that some of the framing that I would have to respond to that question, Ms. Hammond, and dear teacher Lynn, you of course have some questions that some may not have considered. So Dr. Turner has been receiving requests from teachers that are asking to work remotely for a variety of reasons, and of course that was a policy we brought to the board a while back. So Dr. Turner, if first you could talk a little bit about that, not necessarily the numbers because I did not ask you to be prepared for that, but the process of what that may look like.
Absolutely. Right now, our teachers have expressed that they completely understand that their instructional model follows student requests, and they're very willing to support that. In cases where teachers no longer feel comfortable being in person, many have appealed to be able to be virtual to their students. They want to be able to still provide instruction to students. Again, the concern is supervision. We still have to have bodies in those classes to safely supervise our students. So we've reached a point where we've been able to, only to a very limited extent, be able to have that level of flexibility at this point, because our main priority is just making sure we have that supervision in place. Another opportunity to engage teachers during our reentry meetings. We've recently asked teachers to participate in those conversations, and they represent different levels of our district. So there hasn't been a formal survey sent out because we want to be very mindful of what we're asking for, but we've certainly invited them to give us feedback during reentry meetings. They've had some breakout sessions where, without us, they've been asked to step away and speak among themselves and bring data back to us. So I hope that answers your question. We collected it, even though it hasn't been a formalized survey.
And I have heard from several AP teachers who feel very strongly about the 4 days, simply because there's so much they have to cover and they have that end of the course test. And so, even though, I guess I've always told people I'm a Jeffersonian rather than a Hamiltonian. My point is I'd like to see what the majority of teachers really do feel we need to, handle this pandemic until we have a brighter day. So that's important to me, that teachers had input, and the majority of the teachers, because we're going to find a teacher that thinks we should shut down everything. We're going to find a teacher that may think they want virtual. We need to go down to the 5th grade and the 4th grade. So we have a really hard situation to balance and to decide, but I'm going to err on the side of teachers, because teachers are who are in that classroom for the students. And our main job, as Ms. Gardner said, it's in our policy. Number one for us is to be sure students are being taught and that they are getting the best. And I think that key is our teachers. So anyway, Mr. White.
Yeah, I want to make a motion that we support Dr. Melton and give her the authority to make the necessary adjustments to their entry plan based on what she thinks is best for teachers and students, and given the current circumstances.
Okay. And do I have a second? All right, I think that dies for lack of a second. I know we've been here almost 2 hours. This is important. If there's any other question to Dr. Melton, if there's anything from Ms. Huddle, Mr. Lovelace up there, if I've missed you, Mr. White, Ms. Gardner, Ms. Blackburn-Hines, and Mr. Hogan, we have a lot to balance here in our hands. I don't think there's any one right answer. I think I'll go back to what I said when I opened. I think it is imperative that we as a board support and back up our superintendent, but only after we've had our questions answered and what goal we want to pursue in changing as we said, to adjust. I like that word. That was the word I used. To adjust this plan. So is there any other motion anybody would like to put on the table?
I would.
All right, Mr. White,
I'd like to make a motion, we adjourn.
is there a
I
second?
think we talked this to death.
Is there a second to adjourn?
Mr. Lovelace?
Oh, Mr. Love, it's not fair, you're already home. Okay, it's okay. We had a second.
We have to make a decision.
Doesn't that need to be a decision?
That's what I thought.
Lack of motion means decision. That is the decision.
Yeah, I mean, I was asking for motions. You have one? Mr. White made one.
I made a motion, we adjourn.
Without addressing.
Well,
Dr. Melton.
nobody's, I guess what I'm saying is, he seconded it. You're right. We can vote on it, okay? I mean, the motion's on the floor. If you feel like we need to do some more, you want to amend the motion, Mr.?
Was Mr. Lovelace seconding Mr. White's motion?
What I thought.
To support Dr.
If
Melton?
we adjourn, we're not gonna address.
I mean,
Dr.
if
Melton.
somebody has a different motion that based on the discussion tonight, I can always withdraw my motion. But if we're just gonna sit here and just go around in circles, we might as well conclude.
I understand,
And let
Mr.
everybody go
White.
home.
I mean, I
The
understand.
motion on the floor is for adjourning. We should vote on that.
So I've got a statement that might end with a question.
Well, I think procedurally, I had a motion and second, but the motion can fail, Mr. Hogan. It's all I know. In that, Aaron, are you wonderful with Robert's rules? If I've had a motion and a second? You are. I have to take it. Okay, that's what I thought. All right, all those in favor of adjourning, raise your hand. 1, 2, 3, 4. Those not, 3. 4 to 3, we lost. It's adjourned.